Good morning, everyone. At this time, I'm going to call to order the Joint Subcommittee on Human Services. Secretary, can you please call the roll?
Assemblymember Brown May. Here. Assemblymember Dickman. Here. Assemblymember Hathen. Here. Assemblymember Hibbets. Here. Assemblymember Howdegi. Here. Assemblymember Monroe Moreno. Here. Assemblymember Yeager. Here. Senator Canizaro. Here. Senator Dondero Loop. Here. Senator Stone. Here. Senator Titus. Here. Assemblymember Mosca. Chair Wen.
And good morning, everyone. We've got a lot to get through, so we are just going to jump right in. Today, we are all about Medicaid. So if we can begin, Mr. Kucera.
Thank you, Madam Chair. Good morning. John Kucera, LCB Fiscal for the record. This morning, the subcommittee will be hearing 10 budgets totaling just short of 120 pages in the closing packet. This includes 8 budgets within the Division of Healthcare Financing and Policy, also known as Nevada Medicaid, and 2 associated budgets within the Director's Office. Beginning on page 3 of your closing packet is the Prescription Drug Rebate Budget Account 3245. There are 3 major issues within this budget. The Governor recommends the continuation of the Prescription Drug Rebate Budget Account that was established during the 81st 2021 legislative session. The first major closing issue, again on page 3 of your closing packet, is projected prescription drug rebate revenue growth totaling $55.2 million in each year of the 25-27 biennium, as projected by the agency. In total, within this decision unit, revenue supporting prescription drug rebate growth would total $471.5 million in each year. The methodology utilized to project prescription drug rebate revenue totals 13.3% in fiscal year 26 only, based on an agency calculation of the prescription drug spend between calendar year 22 and calendar year 23. Recognizing the magnitude and variability of drug rebate revenues received by the division, the 2019 as well as the 2021 money committees issued letters of intent asking the agency to refine its methodology as well as develop additional information and insight related to prescription drug rebate revenue. According to the agency, over the 23-25 biennium, no methodology was utilized to project rebate revenues, and as a result, the fiscal year 22 actuals were utilized. Looking at the table at the middle of page 4 of your closing packet shows the $416.3 million in rebate revenue as was approved by the 2023 legislature for fiscal years 24 and 25. Multiplied by the governor recommended total of 13.3% yields that $471.5 million in each year. There's a table at the bottom of page 4 outlining the total prescription drug rebates received by fiscal year. Jumping over to the updates at the top of page 5 and moving on to page 6 of your packet. Updated information was provided by the agency as shown in the table in the middle of page 5. And the agency also indicated that the methodology used to provide prescription drug rebate expenditures in calendar years 22 and 23 was not able to be replicated, and this table represents the updated information. As shown, the similar growth between calendar year and 22 and calendar year 23 is shown at approximately 7%, which is different than the 13.3% recommended by the governor in the original budget. As used in the projection, the fiscal year 25 legislatively approved total of $416 million compared to fiscal year 24 actuals of $542.8 million, as well as fiscal year 25 projected rebate revenues as approved at the April 3rd meeting of the Interim Finance Committee, totaling approximately $481 million. There is no rebate growth projected between fiscal years 26 and 27, and fiscal staff will note that expenditure figures presented are historical and don't include projected growth of expenditures, inflation, or consider projected caseload changes. Given the difficulty of obtaining reliable drug expenditure data, the volatility of rebate revenues, as well as inconsistent projection rebate methodology utilization, the subcommittee may wish to recommend the issuance of another letter of intent to report to the Interim Finance Committee by August 2026 detailing the progress made by a selected vendor in establishing rates, repeatable methodologies for calculating prescription drug rebate revenues. Also, given the conservative estimate of prescription drug rebate revenue, the subcommittee may wish to increase rebate revenue projection by approximately $756,000 in each year, which would yield a state share of $250,000 to be matched with federal Medicaid funding totaling approximately $500,000 each year of the biennium to support an expert vendor to assist the agency in providing updated rebate and prescription drug inflation and related information. Moving on to the top of page 6, in the event prescription drug rebate revenues projected are less than what's received, the agency would make a request to the Interim Finance Committee to transfer excess revenue to the Medicaid budget, where the state share would be used to offset general fund appropriations. In short, surplus rebate revenues would result in additional general fund offset in the Medicaid budget account, which would be reverted at the end of each fiscal year of the 25-27 biennium. The motion in the middle of page 6 is as follows. Does the subcommittee wish to recommend approval of option consideration 1, $55.2 million in each year of the 25-27 biennium in additional prescription drug rebate revenue to be transferred to the Medicaid budget account to offset general fund appropriations and make required repayments to the federal government? And number 2, additional prescription drug rebate revenue totaling $756,430 in each year of the 25-27 biennium, approximately 33% of which would be used as the state share to fund contractual expenditures to support a vendor in the Medicaid administration budget in a special use category to assist with prescription drug expenditure data, as well as rebate revenue projections, and approximately 67% would be returned to the federal government. If option 2 is recommended for approval, the subcommittee may wish to recommend the issuance of a letter of intent to provide a report to the Interim Finance Committee by August 1st, 2026, detailing the progress made by a selected vendor in establishing reliable, repeatable methodologies for calculating prescription drug expenditures, drug inflation, projecting rebate revenue, and projecting the state's share of rebate revenue.
Do we have any questions? Seeing none, I'd entertain a motion.
Thank you, Chair. I would motion to approve yes to 1, 2, and 3.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Do we have any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries unanimously. Mr. Kucera, begin.
Thank you, Madam Chair. Moving on to major closing issue number 2 on page 6 of your closing packet. This is the single preferred drug list, decision unit E252. The governor recommends additional prescription drug rebate revenues of $12.5 and $25 million in fiscal years 26 and 27 respectively, resulting from the recommendation to implement a single preferred drug list. According to the agency, a preferred drug list is a list of outpatient drugs that the state will encourage providers to prescribe over others as a mechanism to negotiate higher supplemental rebates. Moving on to page 7, the agency indicated additional rebate revenue included in the governor's recommended budget was determined in partnership with contracted rebate vendors and a contracted actuary, the result of which showed an approximate $20 million increase in incremental rebates received. The agency indicated a desire to be conservative and included only $12.5 million in 26 and $25 million in 27. The federal and state share split is shown on the middle of page 7. Moving to the update component, there are 2 concerns related to this major closing issue. The first is rebates and expenditure projections associated with the implementation of a single preferred drug list, and number 2 is accounting for the state share of services funded with rebate revenue and the return of the non-state share to the federal government. Regarding the rebate and expenditure projections, the agency reiterated that rebate projections are estimated to be conservative and may total as much as $20 million per fiscal quarter. Similar to total projected rebate revenue discussed in major closing issue 1, in the event rebate revenue exceeds projections, a request may be made to the Interim Finance Committee for approval to transfer that additional funding over to the Medicaid budget to liquidate the state share as general fund offset and return the federal share to the federal government. Regarding the state share of rebate revenue, the required return of the federal share of rebate revenue was not included in the companion decision unit E252 in the Medicaid administration budget account, which funds the associated administrative expenditures. Additionally, on April 1st, 2025, the Governor's Finance Office submitted budget amendments A25-826-3158, A25-053-243, and A25-837-3245, which recommended several changes to the rebate revenue and associated expenditures. Additional budget amendment A25-111-3243 was submitted on January 24th and is discussed in the Medicaid budget, as also was heard during the February 27th hearing. In an attempt to try to consolidate all of these components as these budget amendments span multiple decision units and multiple budget accounts, the table at the top of page 9 consolidates all of these components by Governor recommended, the amended component, as well as the difference. The following discussion relates primarily to the implementation of a single preferred drug list, and additional decision units 262, 281, 301, and 303 are discussed in the next major closing issue. So relating to the implementation of the single preferred drug list 254, 259, and 252, Decision Unit E254 was the original recommendation to receive additional rebate revenues in the Medicaid budget. This was removed and replaced with Decision Unit E259 within the submitted budget amendments. Decision Unit E252 includes an increase to administrative expenditures totaling $2.2 million, including an additional $1.2 million in general fund over the biennium to provide additional vendor support and contractual expenditures. In summary, for major closing issue number 2, the subcommittee may wish to consider recommending approval of the implementation of a single preferred drug list, which includes several necessary components that should be considered together. In total, the implementation of a single preferred drug list would total $3.3 million, including $10.7 million general fund reduction over the biennium. The bullets at the bottom of page 9 indicate these 4 components. The first, as discussed, is incremental drug rebate revenue of $12.5 and $25 million. There's associated expenditure neutral adjustments in the prescription drug rebate budget. There are reductions to general fund appropriations representing the state share of rebate revenue totaling $11.9 million. That's the gross benefit of the implementation of the single preferred drug list. And there are also associated administrative expenditures totaling $3.3 million, including $1.2 million in general fund. Moving at the top of page 10, additional discussion related to this proposal, including additional components, follows in major closing issue number 3. The motion for the subcommittee is as follows at the top of page 10. Does the subcommittee wish to recommend approval of additional prescription drug rebate revenues of $12.5 million in fiscal year 26, $25 million in fiscal year 27, including net general fund reductions of $3.3 million in fiscal year 26 and $7.4 million in fiscal year 27, resulting from the recommendation to implement a single preferred drug list between fee-for-service and managed care delivery models, including associated administrative expenditures and adjustments in the Medicaid and Medicaid administration budget accounts?
Do we have any questions? I do have a comment on this. I do believe that being able to negotiate this single preferred drug list will ultimately be more cost efficient for our state, but also provide more certainty for Nevadans. One of the things that in our conversations with the agency, and I appreciate them having those conversations, is the need for potentially an additional medical epidemiologist position to support that implementation of that new single preferred drug list. So I would entertain an additional motion to approve that additional funding for that position. And with that, I would accept a motion.
Thank you, Chair. With that, I would first motion to approve, as stated by staff, the motion on page 10. And in addition, I will add to that motion to recommend approval of approximately $146,000, $73,000 general fund in FY 2026, and approximately $286,000, $72,000 in general fund in FY 2027 to fund one medical epidemiologist position beginning January 1st, 2026 to support the implementation of the new single preferred drug list.
Do I have a second?
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Do I have any discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and let's move on to the next item.
Thank you, Chair Wynn. John Kucera, LCB Fiscal for the record. Moving on to major closing issue 3, in the middle of page 10 of your packet, is the return of the federal share of prescription drug rebate revenue. The governor recommends 4 decision units that transfer prescription drug rebate revenue totaling $14.4 million in fiscal year 26 and $14.3 million in fiscal year 27 to fund the non-federal share of expenditures supporting graduate medical education, vendor support, Medicaid enrollment through the Nevada Health Link, and professional development activities. In summary, the recommended enhancements did not account for the return of federal share required, including approximately 67% of prescription drug rebate revenue. The table at the top of page 11 was provided during the subcommittee hearing and outlines the potential $12.5 million need to account for the return of federal rebates. Skipping to the update, which includes information provided by the agency as well as associated budget amendments, there are 2 updates that will be provided. First is the recommendation through budget amendments to utilize general fund savings resulting from the implementation of a single preferred drug list that was considered a major closing issue number 2. And second is consideration of the rate used to calculate the state share of rebate revenue. First, related to general fund savings from the implementation of a single preferred drug list. The agency indicated the intent to utilize savings generated from the implementation of a single preferred drug list that was just approved in major closing issue number 2 to fund the state's share of various enhancements. These enhancements are detailed on page 12. However, these will also be considered in the Medicaid administration budget account, and approval of this major closing issue just reflects the revenue component. Briefly reviewing Decision Unit E262 is support for graduate medical education, which after consideration of associated budget amendments would total $7.6 million, including $3.1 million in general fund over the 25-27 biennium, and this is included in major closing issue number 10 in the Medicaid budget account. Decision Unit E281 includes vendor support and personnel expenditures to support a healthcare purchasing strategy. As amended and adjusted after consideration of all those components, this recommendation would total $2.8 million, including $1.4 million in general fund over the biennium. Decision Unit E301 will also be discussed in the Medicaid administration budget account, major closing issue number 3. And after consideration of budget amendments and adjustments, this would include total funding of $50.2 million and $5.5 million in general fund to move Nevada Medicaid eligibility for the MAGI, the Medicaid adjusted gross income population, to the Nevada Health Link. Decision Unit E303 did not change in total funding, but did include an additional $257,348 in general fund to properly account for the return of the non-federal share of rebate revenues. And this is discussed in major closing issue number 2 in the Medicaid budget account. In summary, the implementation of a single preferred drug list is projected to reduce general fund appropriations by net $10.7 million over the biennium. The governor, through submitted budget amendments, recommends utilizing $9.5 million of the savings, the net of which would result in general fund savings of $1.3 million over the biennium. The subcommittee, if the as major closing issue number 2 was approved, may wish to approve some, none, or all of the recommendations noted as just described. Moving on to the second component of major closing issue number 3 is the calculation of state share of rebate revenue on page 13 of your closing packet. Relating to the percentage utilized to determine the state share of rebate revenue, the agency confirmed the base budget includes a 22% state share. However, all enhancement units recommended in the budget include a state share of 33.1%, which reflects the actual fiscal year 24 amount. Additionally, the agency indicated fiscal year 25 is showing a slightly increased state share of 34.6%. During testimony, the agency indicated a preference to use the 33.1% to be conservative. In follow-up correspondence, when asked if the base rate of 22% should be adjusted to 33% for consistency, the agency indicated a preference to use the fiscal year 22 state share of 22%. Given the level of uncertainty regarding the federal landscape, and the agency would prefer to maintain this surplus general fund within the Medicaid budget account. The table at the middle of page 13 outlines this surplus appropriation within category 28 is the offline category for Medicaid, which includes approximately $45.9 million in surplus general fund revenue if that 33.1% state share of rebate revenue was applied consistently across the budget. While the letter of intent considered a major closing issue number 2 would require the agency to work with a contractor to help with, among other things, determine a reasonable rate for the state share, the issue of what rate to use in the current biennium remains. And this table outlines the impact of the 22%, which is the governor recommended total, 33.1%, which reflects the actual fiscal year 24 state share, and an average of 27.5%, which splits the difference. As noted previously, rebate revenue has historically been used to offset general fund appropriations and to make required repayments of the non-state share to the federal government. The general fund offset is not explicitly identified as a line item, but rather it's a reduction to general fund in that noted offline category. If surplus general fund appropriations remain, it's difficult to track and identify how and if they are expended. A work program request would likely be made to move authority from that category to the medical spend categories. And given that a work program would likely be required, fiscal staff recommends placing any approved surplus general funds in a one-time special reserve budget category. This would allow surplus general funds to remain within the agency, and it would make the funds available for their use subject to the work program revision requirements of NRS Chapter 353. The motion at the top of page 14 is as follows and includes both components discussed. Does the subcommittee wish to recommend approval of decision one, use of general fund savings from the implementation of a single preferred drug list? Decision units E262, E281, E301, and 303, including associated technical adjustments, and budget amendments A25, 837, 3245, and A25, 058, 3245, consistent with decisions made in the associated major closing issue in the Medicaid and Medicaid administration budget accounts. And option 2, calculation of state share of rebate revenue. Utilize a 22% state share of base budget rebate revenue based on the governor's recommended budget, resulting in $91.8 million in general fund appropriations offset in the Medicaid budget account each year of the 25-27 biennium, which would have no general fund impact. Or option B, a 33.1% state share based on fiscal year 24 actual state share of base budget rebate revenue, resulting in $137.6 million in general fund appropriations offset in the Medicaid budget account each year of the 25 to 27 biennium, which would result in general fund savings of $45.9 million in each year of the biennium. If option 2B is selected, does the subcommittee wish to recommend placing surplus general fund appropriations totaling $45.9 million each year of the 25-27 biennium in a one-time special reserve budget category, which would maintain funding in the Medicaid budget account but require the submission of a work program to the Interim Finance Committee to expend any reserve funding, subject to the work program revision requirements of NRS Chapter 353?
Do we have any questions? I would say that I know that the governor recommended that 22% state share rate, and the agency projected in fiscal year 24 a 33.1% share rate. I do feel more comfortable, and I think this committee might feel more comfortable if we went with the average of 27.5%. And with that, I would entertain a motion.
Thank you, Chair. I will make a motion based on that to first recommend approval of decision units E262, E281, E301, and E303, including associated technical adjustments and budget amendments A25, 837, 3245, and A250, 583, 245, consistent with decisions made in the associated major closing issues in the Medicaid and Medicaid administration budget accounts, and recommend 27.5% for the state share of the $22.9 million in general fund savings generated each fiscal year. $11.5 million would be added to a special reserve category within the Medicaid budget account to be utilized by the agency if a general fund shortfall is encountered, subject to the work program revisions of NRS Chapter 353, and $11.5 million would be returned to the general fund as savings.
Do I have a second? I have a motion from Assemblymember Mosca, a second from Senator Dondero Loop. Do we have any further discussion on the motion? Go ahead, Senator Dondero Loop.
Thank you very much. That's why I was a little slow on the second. So am I clear that on the second piece that the chair read, it was instead of the 33.1, it was 27.5?
That is correct. The governor's recommended was 22%, and the 2024 showed a 33%, and the average is the 27.5. And out of an abundance of caution, that is the decision that we went with.
Okay, thank you.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries unanimously. We'll move on to the next closing issue.
Thank you, Madam Chair. This was excluded from the closing packet, but fiscal staff does request technical adjustment authority as there are no other closing items in this budget account.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Chair Dondero Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and that brings us to our next budget.
Thank you, Madam Chair. Moving on to the Nevada Medicaid budget account 3243 on page 15 of your closing packet. There are 13 major closing issues, a baker's dozen for the subcommittee this morning, and we'll start with Medicaid caseload at the top of page 16 of your closing packet. The governor recommends funding changes totaling reductions of $380.9 million, including $15.7 million in general fund decrease in fiscal year 26, and reductions of $270.3 million, including $29.8 million general fund increase in fiscal year 27 to support projected changes in the Medicaid caseload. Fiscal staff notes that this includes $783,421 in fiscal year 26 and $794,536 projected caseload in fiscal year 27. The executive budget for the 25-27 biennium includes changes to the methodology included with the legislatively approved budget relating to costs projected for very low birth weight, stop loss, and maternity payments. And that has been projected as an update by the agency and will include a quick update in the following pages of this major closing issue. Moving to the middle of page 17, budget amendments A25080 3243 and A25089 3243 were submitted on January 24th to correct errors in the governor's recommended budget related to funding amounts included for the waiver and county contribution Medicaid eligibility categories. The updated dollars reflected in these budget amendments is shown at the table in the middle of page 17. The updated cost per eligible resulting from those same budget amendments is included at the top of page 18. Budget Amendment A25048 3243, which will also impact Decision Unit M101 in a future major closing issue, would correct the FMAP claiming used to offset general fund appropriations. FMAP claiming is an adjustment that allows the state to true up federal revenue received through various supplemental payment programs. The hearing update for this major closing issue is provided on page 19 and shows a 0.6% and a 1.0% increase in caseload, which changed from the October actuals to the February actuals as typically used in the legislatively approved budget. The M200 and 201 decision units include consideration of the previously mentioned budget accounts and the net impact of the caseload updates, as well as all relevant budget amendments as shown at the table in the middle of page 19. In total, decision units M200 and M201 include reductions of $287.5 million, including a $26.8 million general fund reduction in fiscal year 26, and reductions of $110.7 million, including a $13.7 million general fund increase in fiscal year 27. Updated caseload projections provided by the agency do include a return to the previously utilized methodology for very low birth weight, stop loss, and maternity payments using an average times by a calculated estimate. The associated major closing issue motion at the top of page 20 is as follows. Does the subcommittee wish to recommend approval of funding associated with updated caseload projections, including budget amendments A25080 3243, A25089 3243, and associated components of A25048 3243 to correct the cost per eligible of the waiver and county indigent eligibility categories as well as FMAP claiming, totaling reductions of $287.5 million, including $26.8 million general fund reduction in fiscal year 26, and reductions of $110.7 million, including $13.7 million general fund increase in fiscal year 2027.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Dondero Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries, and we'll move on to the next closing item.
Thank you, Madam Chair. Major closing issue number 2 is the waiver caseload. As recommended, includes $43.6 million, including $606,207 in general fund in 26, and $55.8 million, including $1.6 million in general fund in fiscal year 27, for increased costs associated with expanding number of waiver slots in the Division's 3 approved Medicaid home and community-based services waiver programs. As shown at the table at the top of page 21, includes the total governor recommended. Table at the top of page 21 includes the governor recommended totals. As shown in the preceding table, the budget includes $92.5 million over the 25-27 biennium for caseload growth related to the individuals with intellectual disabilities and related conditions caseload. However, the requested caseload increase over the biennium includes 118 slots, which would seem to require less than the $92.5 million in additional expenditures. Additionally, the base caseload was calculated incorrectly using the July 2025 projections from the prior legislatively approved budget. Additionally, fiscal staff notes no waitlist reduction decision units are included in the governor's recommended budget. Moving on to hearing discussion and post-update information, The table at the top of page 22 includes the same standard caseload updates provided by the Office of Analytics using February 2025 actuals and received in March of 2025. After caseload FMAP adjustments and corrections, the individuals with intellectual disabilities waiver caseload expenditures would decrease by $22.5 million, including $421,000 approximate increase in general fund in 26, and a decrease of $20.6 million, including a $1.1 million general fund increase in 27, with also adjustments to the frail elderly and the persons with physical disabilities waiver. As noted in the subcommittee closing for the Aging and Disability Services Division on April 25th and April 30th, alternatives to the governor's recommended budget were approved. While the resulting impacts to the Medicaid budget based on those decisions in the closing for the Aging and Disability Services Division are not anticipated to have significant general fund impact on the Medicaid budget account, adjustments to federal funds transferring Medicaid federal authority to the Aging and Disability Services Division over the 25-26 biennium are likely. The decision at the bottom of page 22 for the subcommittee is as follows. Does the subcommittee wish to recommend approval of waiver slot increases based on March 2025 caseload projections totaling $22.4 million, including $1.3 million general fund in fiscal year 26 and $38.1 million, including $3.4 million in general fund in fiscal year 27?
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Do we have any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving on to major closer issue number 3 relating to the federal medical assistance percentage or FMAP rates. The governor recommends, this on page 22 of your closing packet, the governor recommends $24.4 million and $27.0 million in general fund appropriations in fiscal year 26 and 27 respectively, along with increases to county revenue and corresponding decreases to federal revenue to account for decreases in the FMAP rate projected over the biennium. As shown at the table on the middle of page 23 are the governor recommended FMAP rates. Jumping to the update at the bottom of page 23 shows a 0.15 percentage point reduction in the standard FMAP rate and a 0.11% in the checkup enhanced FMAP rate resulting from the FFIS as the Federal Funds Information for States update received in either late March or early April of this year. The result of this FMAP change would result in additional general fund appropriations totaling $4.3 million in fiscal year 2027. These decision units were previously included in the base budget for Medicaid, and for transparency purposes, the governor recommended a separate decision unit in M151 to just reflect the expenditure neutral adjustments, increasing general funds and offsetting reductions in federal funds. The decision for the subcommittee at the top of page 24 is as follows. Does the subcommittee wish to recommend approval of general fund appropriations totaling $24.4 million in fiscal year 26 and $31.4 million in fiscal year 27, along with increases to county revenue and corresponding decreases to federal revenue to account for decreases to federal medical assistance percentage or FMAP rates projected over the 25-27 biennium, including the noted technical adjustments to correct the fiscal year 27 FMAP rate based on the April 25 Federal Funds Information for States update?
Do we have any questions? Seeing none, I'd entertain a motion.
Thank you, Chair. I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries unanimously.
Thank you, Madam Chair. Moving on to major closing issue number 4 on page 24 of your closing packet. This is provider reimbursement rate increases. The governor recommends $98.9 million, including $17.4 million general fund in 26 and $135.0 million, including $33.5 million in general fund in 27, to fund mandatory and discretionary reimbursement rate increases for Medicaid providers. This is broken up again into mandatory and discretionary. The first is the mandatory rate increase, including M101. As recommended by the governor, the recommended budget did not include inflation increases for managed care dental or medical capitation, which are per member per month payments. Moving to page 25, Budget Amendments A25079-3243 was submitted by the Governor's Finance Office on February 23rd, which contains additional funding totaling $112.6 million, 23.8 of which is general fund in 26, and $200 million, 42.5 million of which is general fund in fiscal year 27, to account for agency projected mandatory inflation for dental and medical cap payments. Additionally, the agency indicated the methodology used to calculate fee-for-service inflation changed from what was previously approved by the 82nd Legislature to remove duplicative efforts related to caseload impacts, which are discussed and approved in the second major closing issue, including M200 and M201. Budget Amendment A 25048 3243 was previously discussed and includes corrections to FMAP claiming totaling $6.2 million and decreases the federal revenue by $12.8 million over the 25-27 biennium to correct the state share of federal medical assistance percentage claiming. Moving to updates for the mandatory rate increases M101, the table at the top of page 26 tries to summarize all of these components, including corrections submitted via budget amendment for accounting adjustments, including that FMAP claiming, the inclusion of managed care inflation, as well as caseload updates. After everything is considered, the M101 decision unit totals $153.9 million, including $41.9 million in general fund in 26, and $275.4 million, including $74.1 million in general fund in 27. Moving to information related to the discretionary rate increases. The governor recommends $112.2 million, including $156.6 million in general fund, approximately $157,000 in general fund over the 25-27 biennium to support optional rate increases. Historical precedent for both of these rate increases include a start date of January 1 at the beginning of the calendar year, and some of the rate increases for managed care include an increase starting July 1 at the beginning of the fiscal year. The agency indicated the new calendar year 26 managed care contracts will require managed care organizations to provide reimbursement rates equal at a minimum to the rates paid for fee-for-service. However, this change does not address the need to budget managed care expenditures between July 31, 25 and December 31, 2025. The discretionary rate increases are itemized in sections A through F, starting on page 27 of your closing packet, the first of which is M102 in home delivered meals. The governor recommends $388,385, including $156,579 in general fund over the biennium for food inflation related to the home delivered meals program. Inflation rates of 2.4 and 2.4% in fiscal year 26, along with similar inflation rates in fiscal year 27 were used. Section B is community paramedicine as decision unit E266. The governor recommends $31.4 million in federal revenue and transfers from the Improve Healthcare Quality and Access Budget Account, which is private hospital provider tax funds, over the biennium to reform rate methodology for community paramedicine. According to the agency, community paramedicine is the provision of basic and preventative healthcare services to individuals in their homes by emergency medical technicians. The agency indicated this request includes new rates that would be utilized by community paramedicine as outlined in the following table. The additional information provided by agency in follow-up detailing the individual rates and what was changed is also included as an attachment at the end of this budget account. Regarding the managed care expenditures beginning July 1, the agency confirmed there is no intent to adjust rates mid-year. However, as all of these components are funded with private hospital provider tax funding, in the event that authority is over budgeted, funding would either not be transferred or would be reverted back to the private hospital provider tax budget account. So there's no impact to the general fund and no impact to agency resources. In regards to the proposed rate methodology reform recommended for community paramedicine, the subcommittee inquired about the impact to service availability throughout Nevada. The agency indicated the rate increase is modeled after other rates utilized in Arizona and would resemble a bundled payment model, the intent of which would be to incentivize providers to increase statewide capacity. Moving on to partial hospitalization services is section D of this major closing issue. The governor recommends $6 million in federal revenue and transfers from the Improve Healthcare Quality and Access Budget Account, again, private hospital provider tax funds, over the biennium to increase the daily rate for partial hospitalization services from $328.68 to $500 a day. According to the agency, partial hospitalization services are designed to include both mental and behavioral health services and psychiatric treatment for patients who require a higher intensity of coordinated care. The agency also indicated the targeted rate of $500 per day is intended to reflect the increase in medical inflation since the last rate review, and it does not appear in analysis at the time of the hearing was conducted. The agency provided additional follow-up information clarifying that the analysis related to this rate increase is part of the quadrennial rate review as well as comparisons to other states. For example, New Mexico's rate is $673, California's $671, and Virginia's is $500. Moving to day treatment services E272, section D of this major closing issue. The governor recommends $9.5 million in federal revenue and transfers of private hospital provider tax funds over the biennium to increase the hourly rates for day treatment services from $32.43 to $100, which is a 208% increase. According to the agency, these align with comparable services. There was an update provided on this service. in regards to the annual cost of day treatment services totaling approximately $28,000 per patient. The agency indicated the rate is reflective of the gaps in access to services and community needs, and while some states pay a lower rate, including Colorado's at about $44 a day, and Virginia's at about $45, I'm sorry, these are hourly rates. Yes, $44.38 per hour and $45.21 per hour, but they do not limit the number of provided hours. The agency believes a $100 per hour rate combined with recommended utilization management, limiting services, is reasonable. Option E is inpatient psychiatric and detox facilities, decision unit E273. The governor recommends $63.5 million in federal revenue and transfers of private hospital provider tax funds over the biennium to increase the daily rate for psychiatric detoxification facility services from $944 to $1,250. This is in addition to the approximate average $244 daily rate increase that was approved at the April 11th, 2024 meeting of the Interim Finance Committee. Moving to updates on the same component, as noted previously, this recommended increase is in addition to the $244 approved by the Interim Finance Committee in April. When the subcommittee inquired why a second rate increase was recommended prior to the first becoming effective, the agency indicated the increase approved in April of 2024 was a first step to establish rate parity between inpatient psychiatric and detox facilities and general acute hospital facilities. However, additional rate increases were necessary to support hospitals and serve individuals with behavioral health needs. Moving to section F on page 30, relates to skilled nursing facility quality incentive payment, decision unit E275. The governor recommends $1.4 million in federal revenue and transfers from the improved healthcare quality and access and private hospital provider tax funds in fiscal year 27 to support a 3% annual quality add-on payment for skilled nursing facilities participating in the BCCP, the Behaviorally Complex Care Program. The agency indicates savings would be generated over time from fewer out-of-state placements or inappropriate high-cost patient stays. However, there's no savings associated within this decision unit. Fiscal staff will note that there are associated expenditures, including a management analyst position, in the Medicaid administration budget. The agency testified that the current system is based on a complexity tier structure, and a program would be created where facilities could apply for participation in the program. Metrics would be developed relating to the length of time for placement, quality of care, and funding would be utilized to develop additional metrics for the quality payment program. The motion on page 31 reads, does the subcommittee wish to recommend approval of decision unit M101, which includes mandatory rate increases totaling $153.9 million, $41.9 million of which is general fund in fiscal year 26, and $275.4 million, $74.1 million general fund in fiscal year 27, including associated components of Budget Amendment A25-048, 3243, to correct FMAP claiming, and Budget Amendment A25-079, 3243, to include managed care inflation. And discretionary rate increases, including decision unit M102, is $388,385, including $156,579 in general fund over the 25-27 biennium to support inflationary rate increases for home-delivered meals. Decision unit E266 is $31.4 million in federal and private hospital provider tax revenue and county revenue over the 25-27 biennium to support rate increases for community paramedicine providers. Decision unit E271 is $6 million in federal private hospital provider tax and county revenue over the 25-27 biennium to support rate increases for partial hospitalization services. Decision unit E272 is $9.5 million in federal private hospital provider tax revenue and county revenue over the 25-27 biennium to support rate increases for day treatment services. Decision unit E273 is $63.5 million in federal private hospital provider tax revenue and county revenue over the 25-27 biennium to support rate increases for psychiatric and detox facility services. And finally, decision unit E275 is $1.4 million in federal private hospital provider tax revenue and county revenue in fiscal year 27 to support a quality incentive payment for the Behaviorally Complex Care Program.
Do we have any questions? With that, I'd entertain a motion.
Thank you, Chair. Here I will motion to approve decision unit M101, the mandatory rate increase, and for the discretionary rate increases A, C, D, and F.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Do we have any further discussion on this motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving along to major closure issue number 5 on page 31 of your packet relates to applied behavior analysis rate increase. The governor recommends $2.3 million, including $900,856 in general fund over the 25-27 biennium to support rate increases for ABA or applied behavior analysis services when compared to similar rates provided by other states. Nevada Revised Statutes, Chapter 422, requires the Director of the Department of Health and Human Services to adjust rates for ABA services comparable to rates of reimbursements paid by Medicaid programs in other states. During the 82nd 2023 legislative session, the many committees included back language in the Appropriations Act indicating that only rate increases for applied behavior analysis services should be included in the recommended budget, and no rate decreases should be approved. Consistent with actions taken by the prior legislature, the governor recommended budget only increases applied behavioral analysis rates. Moving to the update on page 32 of your closing packet, after the February 27, 2025 hearing, the agency indicated the statute in question was ambiguous and that it was most appropriate to operate based on the legislative intent, which, according to the agency, is to increase rates for applied behavior analysis services comparable with other states. This interpretation is consistent with actions taken by the prior legislature. No action was taken over the current interim to address the ambiguous language in statute, and the subcommittee may wish to recommend approval of one of the options on page 32 if the intent is to recommend approval of the governor's recommendation to increase applied behavior analysis rates relative to other states. First, the subcommittee could determine that the governor's recommended budget reflects the legislative intent of NRS Chapter 422 as well as SB 96 of the 21st session and take no additional action related to rate increases for applied behavioral analysis services. The subcommittee could direct fiscal staff to include language in the 2025 Appropriations Act similar to what was approved in 2023, stating that only increases should be included in the governor's recommended budget for applied behavioral analysis services. Third, the subcommittee could sponsor a bill draft request to clarify existing statute is intended to only increase rates, provide a definition of comparable, determine how states should be selected for comparison, and define the review methodology utilized to set applied behavior analysis rates. The related decision for the subcommittee at the top of page 33 is as follows. Does the subcommittee wish to recommend approval of $2.3,900,856 general fund over the 25-27 biennium to support changes to only those applied behavior analysis rates recommended to increase relative to the median rate of comparable states, as recommended by the governor? If so, does the subcommittee wish to determine that the governor's recommended budget reflects the legislative intent of Nevada Revised Statutes, Chapter 422.27497, as approved through Senate Bill 96 of the 81st 2021 session, and take no additional action? Or direct fiscal staff to include language in the 2025 Appropriations Act similar to language provided in the 23 Appropriations Act that specifies appropriated funding shall only be used to increase rates as included in the governor's recommended budget? And three, sponsor a bill draft request to clarify that statute is intended to only increase rates, provide a definition of comparable, determine which states should be used in the comparison, and define the review methodology to set rates.
Do we have any questions? I do have a couple of questions, just to clarify. Obviously, this was a Senate Bill 96 that was passed during the 2021 legislative session. And looking at it and looking at the way it has been interpreted to have these essentially automatic increases with kind of no methodology as to how we are comparing those. And I guess this is a question for staff. Do you know of any other provider that has auto increases included in statute similar to this?
Thank you for the question, Senator Nguyen. John Kucera, LCB Fiscal for the record. There are a number of requirements that for Medicaid in NRS Chapter 422, among others, that mandate certain services be required. To my knowledge, and additionally, there is a requirement of the quadrennial rate review beginning in 2018, if memory serves, that all rates should be reviewed and recommendations made to the Director of the Department of Health and Human Services relating to rate increases. However, to the best of my knowledge, there is no other rate in statute that has an automatic increase, outside of perhaps mandatory and inflationary adjustments that are required federally for associated services.
So is it my understanding that while we're making these difficult decisions throughout these budgets about whether or not we're able to increase rates, with this particular decision unit and these particular providers, because of this law that's currently in statute, we are unable to make those, we have to continue to give increases, whereas other people are seeing some of their budgets either being cut or their rates remaining stationary?
Senator Nguyen, John Kucera, LCB Fiscal for the record. I think that's a fair interpretation. The relevant statute in 422 does require the agency to include this in their state plan, and they certainly could do it without explicit legislative authorization or approval. However, this inclusion of a rate increase in statute does appear somewhat out of the ordinary.
Thank you. Do we have any other questions? Seeing none, I'd entertain a motion kind of based on our conversations just now.
Yes, thank you, Chair. Based on that, I'm going to do an alternative motion. I do not recommend approval of $2.3 million, $900,856 general fund over the 25-27 biennium to support changes to only those applied behavior analysis rates recommended to increase relative to the median rate of comparable states as recommended by the governor. Additionally, recommend a bill draft request to amend NRS 422.27497 to repeal subsection 2A to remove the requirement that rates for applied behavior analysis rates be established biannually in the state plan for Medicaid comparable to other states.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries unanimously. Thank you, Mr. Kucera. You can begin again.
Thank you, Madam Chair. Moving on to major closing issue number 6 on page 33 of your closing packet are service expansions. The governor recommends $52.3 million, including $3.3 million in general fund, over the 25-27 biennium to expand covered services within the Medicaid program related to mobile crisis, assertive community treatment, first episode psychosis, adult dental, and services provided to the juvenile justice population. Medicaid agencies are mandated to require certain benefits under the state plan, including but not limited to inpatient, outpatient, and physician services, and these service expansions fall under the discretionary rate component. Through 5 enhancement decision units, the governor recommends expanding services through fee-for-service and managed care organization delivery models, as shown at the table at the top of page 34. Moving on to the individual component, I'll point out one component at the top of page 34. The historical precedent for rate increases and service expansions, as noted previously, includes a January 1, 2026 start date. For many of these services, there is a managed care component that begins July 1, 2025. Again, these associated services are funded with transfers from the private hospital provider tax funds. Our estimates and additional revenue, if needed, could be transferred to or from the private hospital provider tax through a work program submitted to the Interim Finance Committee. According to the agency, mobile crisis, first episode psychosis, assertive community treatment services are a component of the settlement agreement with the Department of Justice. Starting at Section A, Mobile Crisis Decision Unit E258, the bottom of page 34. The governor recommends $1.3 million in federal and transferred revenue of private hospital provider tax over the 25-27 biennium to expand 24/7 mobile crisis services to all participants 21 years of age or younger through a hybrid monthly provider payment and fee-for-service model. Within managed care, reimbursement would be made on an encounter basis, including a rate for urban and rural participants, which is standard to most medical services. Within fee-for-service, the proposed hybrid model would include a monthly capitated payment. The agency indicates the proposed model aims to establish a sustainable funding mechanism for 24/7 mobile crisis services. The agency indicated there are no known services in Nevada that utilize this specific methodology, and that final rates for funding are dependent on vendor review, which has not yet occurred. Vendor support is included in a companion decision unit within the... it is unclear if monthly payments associated with the direct cost of providing medical services are federally allowable, and the agency did follow up and confirm that this is a federally allowable component. The update indicated the intent for the recommendation is to implement a tiered rate to provide payment to community providers to allow for sustainable 24/7 coverage. Additionally, the agency testified an existing vendor would be available to review and determine a final rate structure in a timely manner. Moving to assertive community treatment, Decision Unit E260. Details were provided during the subcommittee hearing, included the governor recommended total of $25.6 million in federal and transferred revenue of private hospital provider tax funds over the 25-27 biennium to provide assertive community treatment services at a daily rate of $381.66 beginning July 1, 2025. Assertive community treatments, according to the agency, utilize a community-based multidisciplinary mental health treatment model. The agency anticipates a limited provider enrollment is anticipated and projects total patient counts of 180 and 360 in fiscal years 26 and 27, respectively. there's an associated companion decision unit. The information provided by the agency in follow-up indicates this is a program currently provided by the Division of Public and Behavioral Health, is the Program for Assertive Community Treatment. Moving on to adult dental, and option C on page 36 includes $17.1 million, including $3.3 million in general fund appropriations. The Governor's Finance Office submitted a budget amendment 25-178-3243 to adjust the implementation date of the recommended expansion to fiscal year 27, which would include reductions of $8.5 million and 1.6 of which is general fund, eliminating all fiscal year 26 funding, and fiscal year 27 funding would be reduced as shown. Part of the updated analysis, the expenditures totaling $8.5 million include a small amount of savings. Moving to first episode psychosis, option D is Decision Unit E274, is $7.5 million in federal funds and revenue transferred from the Improved Healthcare Quality and Access Private Hospital Provider Tax. According to the agency, this program would include pharmacotherapy and primary care coordination, individual psychotherapy and individual resiliency training, family education, and assertive case management. The agency indicates disorders often manifest from 15 to 25, and these services support individuals with severe emotional disturbances. Population level estimates were used and include two rate components, include screening and introduction to program bundled rate and a weekly bundled rate, shown at the bottom of page 36. Finally, juvenile justice services in M504 is $756,347 in federal funds and revenue of private hospital provider tax funding to enhance services provided to the juvenile justice services, including EPSDT, early and periodic screening, diagnosing, and treatment services, and targeted case management for a period of 30 days prior to and up to 30 days after release. This is a companion decision unit noted in the administration budget account. The decision for the subcommittees at the bottom of page 37 is as follows. Does the subcommittee wish to recommend approval of one or more of the following? Decision Unit E258 is $1.3 million in federal private hospital provider tax revenue and county revenue over the 25-27 biennium to fund expanded mobile crisis services. Decision Unit E260 is $25.6 million in federal private hospital provider tax revenue and county revenue over the 25-27 biennium to fund expanded coverage for assertive community treatment services. Decision Unit E267 is $8.5 million, including $1.6 million in general fund in fiscal year 27 to fund expanded adult dental coverage, including Budget Amendment A25-178-3243. And Decision Unit E274 is $7.5 million in federal private hospital provider tax revenue, county revenue over the 25-27 biennium to fund expanded first episode psychosis treatment. Decision Unit M504 is $756,347 in federal private hospital provider tax revenue and county revenue over the 25-27 biennium to fund expanded services to the juvenile justice population.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Darrelloop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries unanimously. Go ahead.
Thank you, Madam Chair. Moving on to major closing issue 7 is the Children's Specialty Managed Care Plan. The Governor recommends $2.9 million in federal funding and transfers from the Improved Healthcare Quality and Access budget account, private hospital provider tax funding in fiscal year 27 to support the administrative component of projected capitation payments related to the proposed Children's Specialty Managed Care Plan. The agency intends to implement a new specialty children's managed care plan over the 25 to 27 biennium. This includes components as noted at the middle of page 38, which would be a single statewide plan that covers all standard behavioral and medical benefits offered by Nevada Medicaid. The agency is exploring several strategies to help implement a specialty children's managed care plan, including increasing the minimum medical loss ratio, requiring community investment, among other things. Preliminary estimated annual medical capitation expenditures provided note a cost of $51.6 million. Notably, this is not an additional cost, and according to the agency, these medical expenditures are included within the base budget, and if approved, would represent simply a shift from fee-for-service expenditures to managed care expenditures. Moving to the update on page 39, these are two components, the administrative services included in this budget amendment, in this major closing issue, as well as medical expenditures for the target population, which according to the agency are within the base budget. However, final rates, program structure, and total cost remain unknown until rates are actuarially set and a managed care organization to administer the plan as selected. The subcommittee may wish to consider the issuance of a letter of intent instructing the agency to provide a report to the Interim Finance Committee 30 days after all of these components are determined. This letter of intent may also include projections of total costs relative to the approved budget, the identification of quality or outcome measures to identify both the fiscal and programmatic impact. The decision unit for the decision for this major closing issue at the top of page 40 reads, does the subcommittee wish to recommend approval of $2.9 million in federal funding and transfers from the Improved Healthcare Quality and Access budget in fiscal year 27 to support the administrative component of projected capitated payments related to a children's specialty managed care plan? And does the subcommittee wish to recommend the issuance of a letter of intent instructing the agency to provide a report to the Interim Finance Committee 30 days after final rates, program structure, and a managed care vendor have been identified, including projections of total costs relative to the approved budget, as well as identification of quality or outcome measures to identify both the fiscal and programmatic impact of the children's specialty managed care organization?
Man, you're such a good reader. Do we have any questions? Seeing none, I'd entertain a motion.
A motion to approve as stated by staff.
A second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrell-Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries unanimously. Not only is he a good reader, I don't want to limit his talents. He obviously prepared all of this stuff for us and worked with agencies to correct a lot of technical adjustments, an MC number actually. So, in addition to good reading, I appreciate everything Mr. Caceres done. So go ahead and begin.
Thank you, Chair Wade. The compliment's well received and appreciated. I also debated in high school, so that's where a lot of this comes from. Major closing issue number 8 on page 40 of your closing packet relates to statewide managed care implementation as Budget Amendment A25-454-3243. The governor's recommended budget did not contain any decision units associated with the requirement to expand managed care organization related to NRS Chapter 422, Section 273. Senate Bill 420 of the 81st session codified in NRS Chapter 422 to the extent funding is available, the establishment of statewide managed care organization program. It's only page 40. I can't lose my voice quite yet. The Governor's Finance Office submitted Budget Amendment A25-051-3243 on January 24th, recommending changes as outlined. The 2023 legislature approved preparatory activities, including 2 positions and approximately $4 million to prepare for the statewide implementation of managed care. Within that decision unit included estimates of what the costs for statewide managed care implementation would be. These are the components that were initially identified as not being included in the governor's recommended budget and are noted at the top of page 41. There have since been many updates, so I will not belabor the old components. However, it did show a net increase in general fund needed over this and future biennia. The updates provided during the subcommittee hearing on March 24th, 2025 included an adjustment to original budget amendments, which showed initially a $41 million decrease of general fund savings resulting from the implementation of statewide managed care. However, as a result of noted concerns with the suggestion of the subcommittee during the February 27th hearing, the agency enlisted the assistance of a contracted actuary to review the methodology. The actuary determined that some of the components required review and adjustment, including those components noted in the bullet points in the middle of page 42, which, among other things, include projecting fee-for-service claims based on a per member per month cost. Following the adjustment, the resulting general fund savings were revised down from the original $41 million as included in the initial budget amendments, which were withdrawn, down to $10 million over the 25 to 27 biennium, $10 million in general fund savings, to clarify. The 2 budget amendment components are at the bottom of page 42, impact Medicaid and checkup, show initial general fund need in fiscal year 26, which generally appears reasonable. When there's a shift from fee-for-service to managed care, the state still has an obligation to pay the claims tail of fee-for-service claims. Those are services that have been incurred but not yet paid. So it makes sense that there is an additional general fund need in fiscal year 26 and a general fund reduction in fiscal year 27, which nets out to approximately $10 million in general fund savings. As noted in the February 27th hearing, the agency has authority to operate the program within the limits of legislative appropriations. If general fund savings projected based on the implementation of statewide managed care program do not materialize, program changes intended to generate savings may be required for the agency to operate within the limits of legislative appropriations. The associated decision unit at the top of page 43 reads as follows. Does the subcommittee wish to recommend approval of budget amendments A25-454-3243 and A25-453-3178, including general fund appropriations totaling $4 million in fiscal year 26 and general fund reductions totaling $14 million in fiscal year 27, along with associated changes to federal revenue to implement statewide managed care within the Medicaid and checkup budget accounts?
Do you have any other questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrell-Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Chairwood. Tracking through to major closing issue number 9 is school health services. The governor recommends a net $1.4 million, including $9.1 million general fund increase over the biennium to utilize general fund appropriations as the non-federal share for the provision of Medicaid reimbursed school health services. The agency made programmatic changes to the school health services program over the interim, which would increase general fund appropriations. According to the agency, the provision of school health services statewide is a federal requirement, and if left up to the individual school districts or counties, services may be disparate among counties. The following table at the bottom of page 43 notes the participating school districts, the amount of local revenue that was received over the interim prior to this change to shift expenditures to general fund. The agency indicated a waiver was contemplated, which would allow for the waiving of applicable federal law or regulation for the statewide requirements of services. However, this solution was not pursued due to resource limitations and the belief that such a request would not likely be approved. The agency indicated outside of legislation making participation in the school health services program mandatory, there is not a mechanism to compel all counties and school districts in the state to participate. The update at the bottom of page 44 reiterated this information and that the general fund is the only available source without a legislative adjustment. The agency indicated their intent would be to continue school health services within the standard Medicaid caseload decision units in future biennia, which would make general fund responsible for the non-federal share, while the current estimate is $9.1 million over the 25-27 biennium. As school districts adopt the program and or expand, the non-federal share is likely to increase, which may increase the share of general fund appropriations in future biennia. The decision at the bottom of page 44 asks if the subcommittee wishes to recommend approval of a net $1.4 million, including $9.1 million in general fund over the 25-27 biennium, to utilize general fund appropriations as a non-federal share for the provision of Medicaid reimbursed schools health services statewide.
Do you have any questions? Seeing none, I'd entertain a motion.
A motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator John Darrell Lute. Do I have any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously. Thank you.
Thank you, Madam Chair. Moving on to major closure issue number 10 on the bottom of page 44 of your closing packet related to graduate medical education. The governor recommends $10 million in transfer from the prescription drug rebate budget account and a matching $14.8 million in federal revenue to support supplemental payments for graduate medical education and workforce enhancements. Additionally, the governor recommends the transfer of $8.5 million in general fund appropriations in fiscal year 26 from OSIT to the Office of Science, Innovation, and Technology, which would move the existing GME program in OSIT to the Nevada Medicaid budget account with associated revenue and expenditure adjustments. There are two distinct components to this major closing issue. One is the existing program, which would increase supplemental payments to teaching hospitals to reflect the higher cost of providing medical care in a teaching environment. Currently, this is University Medical Center, Renown Regional, and Humboldt General. Budget Amendment A25 053-3243 was submitted by the Governor's Finance Office and would remove $10 million in transfers from the prescription drug rebate revenue and associated decreases in federal funding to remove all authority in this decision unit from fiscal year 26, and this is a companion discussed previously in the prescription drug rebate budget account. The second component is the transfer of existing graduate medical education program to Nevada Medicaid, which includes, as noted, $8.5 million in general fund appropriations. I'm going to skip to the hearing update as there were some relevant decisions made in prior closings. During the April 15th, 2025 meeting of Senate Finance and Assembly Ways and Means, the committee approved the transfer of $8.5 million in general fund appropriations from OSIT Office of Science, Innovation, and Technology to the account for the Graduate Medical Education Grant Program, rather than transferring this funding to the Nevada Medicaid budget, as approved in Decision Unit E900. As a result, to be consistent with prior decisions, Decision Units E900 and E500 should not be recommended for approval. However, the committees approved transferring remaining funding from this budget account to the grant program account and authorized the addition of language in the 2025 Appropriations Act to allow remaining funding to be balanced forward. If the establishment of the Nevada Health Authority is approved, as recommended in Major Closing Issue 4 in the Nevada Medicaid Administration budget account, the account for Graduate Medical Education Grant Program would be located in that agency contingent upon Bill Draft Request 401116 or other enabling legislation. Summary at the top of page 47 includes these two components. E262 would expand the existing supplemental payment program for graduate medical education by $7.5 million, including $3.1 million general fund in fiscal year 27. And Section 2 would not approve E500 and E900, which is the receipt of $8.5 million in general fund appropriations and associated federal funding resulting from the transfer of the program from OSIT. The decision for the subcommittee at the middle of page 47 reads, if the subcommittee wishes to recommend 1, the approval of decision unit E262, which is $43,875 in general fund appropriations in fiscal year 26, $7.5 million, including $3.1 million general fund in fiscal year 27, to support the existing graduate medical education supplemental payment program, including budget amendment A25053, 3243, and A25805, 3243. And number 2, not recommend approval of decision units E500 and E900, including $8.5 million in general fund appropriations and $12.6 million in federal funding in 26, consistent with the closing actions of the Joint Full Committee on April 15, 2025.
Thank you. Do we have any questions? Seeing none, I'd entertain a motion.
A motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow-Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. John Kucera, LCB Fiscal for the record. Major closing issue number 11 is Public Assistance Reporting Information System, or PARIS, which relates to Budget Amendment A25-342-3243. Through this budget amendment submitted by the Governor's Finance Office on March 11th, the Governor recommends reductions totaling $46.9 million, including $9.9 million general fund in 26, and reductions totaling $48.2 million, including $10.4 million general fund reductions in 27. A vendor analysis has determined that 50,000 Medicaid participants are also enrolled in another state, and that 25% of this population may also reside in a different state, which could result in savings based on disenrollments and associated managed care payment recovery. Based on this vendor analysis, the budget amendment included the disenrollment of approximately 12,500 participants, including the noted savings. There's a table at the top of page 48, which includes all of the details, including the impact by eligibility category, the total amount of recovered payments, as well as the associated 13% vendor fee, which would be covered through associated savings as well as federal matching funding. While it appears the 50,000 figure used within the analysis is based on the outcome of a prior match report, support and rationale for this information was questioned by the subcommittee. In information provided by follow-up, the agency indicated a consultant reviewed Nevada Medicaid data, including how quickly disenrollments were possible, in addition to findings from a 2022 LCB audit. The agency also testified that there's a current vendor and contract in place to implement the service beginning July 1, 2025. Decision for the subcommittee at the bottom of page 48 is as follows. Does the subcommittee wish to recommend approval of Budget Amendment A25-342-3243, including reductions totaling $46.9 million, including $9.9 million general fund reduction in fiscal year 26, and reductions totaling $48.2 million, including $10.4 million general fund reduction in fiscal year 27 to implement the Public Assistance Reporting Information System verification process?
Do we have any questions? Seeing none, I'd entertain a motion.
A motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow-Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Almost through Medicaid, I promise. Just a couple more. Decision, major closing issue number 12 at the bottom of page 48 is Budget Amendment A25661, 3243, which would utilize fiscal year 25 surplus to fund a single month of fiscal year 26 managed care expenditures. Through this budget amendment, the governor recommends reductions totaling $197.2 million, including $41.5 million in general fund reductions in fiscal year 26, as a result of using a projected fiscal year 25 surplus to prepay 1 month of fiscal year 26 managed care payments early. This budget amendment was submitted and replaces a previously submitted budget amendment A25404, 3243, which was withdrawn. The agency projected as of March a $73.2 million general fund surplus. This budget amendment was submitted by the Governor's Finance Office, a separate budget amendment, A25079-3243, as previously discussed, which included general fund appropriations of $66.3 million to account for the inclusion of managed care inflation in the standard caseload decision units. The agency indicated the submission of this major closing issue would help address some of those additional general fund appropriations. As was discussed during the February 5th, 2025 Joint Full Committee hearing, this budget amendment may address the issue in the Medicaid budget account. However, it does use one-time surplus funds in fiscal year 25 to address an ongoing need. The impact of this budget amendment is shown at the table at the bottom of page 49. Updated information provided by the agency indicated that initial surplus, as projected, was reduced slightly as of April 25 to 71.8 million, which is very similar to the March projection of 73.2 million, and appears sufficient were the subcommittee to recommend approval of this to cover the $41.5 million savings in fiscal year 26 based on utilizing fiscal year 25 surplus. As noted previously, while this proposal would address the operational general fund shortfall in the Medicaid budget, the utilization of one-time surplus funding in 25 recommended would not reduce the need for ongoing appropriations, and as the agency submits their caseload adjustments for the 27-29 biennium, these general fund appropriations would be included in that base budget and or caseload decision units. The decision at the top of page 50 asks if the subcommittee wishes to recommend approval of Budget Amendment A25-661-3243, totaling reductions of $197.2 million, including $41.5 million general fund reductions in fiscal year 26, as a result of using projected 25 surplus general fund appropriations to prepay 1 month of fiscal year 2026 managed care payments early in fiscal year 2025.
Do we have any other questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving on to major closing issue 13, which I'm pretty sure is the last one, is caseload changes based on federal immigration policy impact. Is Budget Amendment A25-672-3243. Through this budget amendment, the governor recommends reductions of $54.5 million, including $14.5 million general fund reductions in fiscal year 26, and reductions of $89.5 million, including $24.1 million general fund reductions in fiscal year 27, as a result of the agency estimating impacts of federal immigration policy on Medicaid caseload. The governor recommends reducing the projected Medicaid population by approximately 14,000% by the end of fiscal year 27. When compared to the caseload originally recommended by the governor, this analysis includes the assumption that 15% of households containing a non-resident would not participate in Medicaid in response to perceived negative associations. The Office of Analytics within the Department of Health and Human Services provided an analysis and indicated this impact would include approximately 1.7% of the Medicaid population by the end of the biennium. This impact is summarized at the table at the top of page 51. Due to the annual redetermination cycle, the Office of Analytics modeled the effect of a 15% reduction on an initial 3% reduction in caseload from households containing individuals with an immigration status of all types, documented or undocumented. As noted in the February 27th hearing, the agency has authority to operate the Nevada program within the limits of legislative appropriations. The hearing discussion and post-update information on page 51, moving to page 52, the agency provided two pieces of supporting documentation. The primary comes from the KFF, which does indicate that previous research and recent experience suggests that this rule relating to the federal charge rule in 2019 will likely lead to decreased enrollment in public programs. The KFF also noted that beyond potential disenrollment, this rule may also deter new enrollment among some of the nearly 1.8 million uninsured individuals nationally. While this issue brief generally supports the connection between heightened federal scrutiny on immigration status and decreased utilization of public assistance program, the scenarios outlined by the KFF, including disenrollment rates of 15, 25, and 35%, are illustrative only. The KFF does not claim to predict an actual disenrollment rate and does note it is difficult to predict what actual disenrollment rates may be in response to the rule. As previously noted, the agency has the authority to operate within the limits of legislative intent, and if savings associated with this major closing issue do not materialize, program changes generating savings may be required. The associated major closing issue motion on page 52 reads, does the subcommittee wish to recommend approval of Budget Amendment A25-672-3243, totaling reductions of $54.5 million, including $14.5 million general fund reduction in 26, and reductions of $89.5 million, including $24.1 million general fund reduction in fiscal year 27, as a result of the agency estimating impacts of federal immigration policy on Medicaid caseload.
Do we have any questions? Seeing none, I'd entertain a motion.
Though I'm sad for Nevadans of what is happening at the federal level, I do a motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving on to other closing items. Most are very standard, including companion decision units in other budget accounts. I will note Budget Amendment A25, 122, 32, 43, as noted in the prescription drug rebate account, and other closing item number 8. Other closing item 9 includes back language recommended by the governor, as well as fiscal staff to include in the 2025 Appropriations Act. A through E are standard and continue previously approved language. Item F includes a requirement that Medicaid providers of personal care services pay direct care staff a minimum base wage, not including benefits, of at least $16 per hour. This was approved by the Money Committees as part of the 2023 Appropriations Act, was, however, not recommended by the governor. However, if the intent of the subcommittee is to continue this requirement, fiscal staff would recommend inclusion of this. Fiscal staff also notes items G and F were recommended by the governor, but were not included in the 2023 Appropriations Act. Item G would allow the agency to balance forward general fund appropriations associated with managed care withheld payments between biennia. The agency, if the standard language is recommended to be repeated, has existing authority to balance general fund appropriations between years in a given biennia, but not between biennia themselves. In the event excess general fund authority remains in fiscal year 27, which could be used to make a payment of withheld funds in a future fiscal year, surplus general funds would be reverted at the end of fiscal year 27, and the agency would make a request for funding in fiscal year 28 to include these withheld or not made payments. As a result, it's recommended this language not be included in the 2025 Appropriations Act. Similarly, in item H, the governor recommended language that would allow funding transferred from the improved healthcare quality and access budget not revert to the general fund. Pursuant to existing statute in NRS 422, money in this account already does not revert to the general fund and must be carried forward to the next fiscal year. Additionally, funding transferred from this budget account is authorized funding and would not be included in the Appropriations Act. The funding does not revert to the general fund and is not included in the Appropriations Act, which means recommended language would have no impact, and it is not recommended to be included in the 25 Appropriations Act. The motion at the top of page 55 reads, fiscal staff recommends other closing items 1 and 5 be closed as recommended by the governor. Other closing item 2 is contingent upon approval of the major closing issue in the indigent hospital care budget account. Other closing item 3 is contingent upon approval of the major closing issue in the upper payment limit budget account. Other closing item 4 is contingent upon approval of the major closing issue in the increased quality of nursing care budget account. Other closing item 6 contingent upon approval of major closing issue 2 in the improved healthcare quality and access budget account. Other closing item 7, including budget amendment A25, 111, 3243, is contingent upon approval of major closing issue 2 in the prescription drug rebate account. And other closing item 8, including budget amendment A25, 122, 3243, is contingent upon the approval of major closing issue 1 in the prescription drug rebate budget account. Regarding 2025 Appropriations Act language recommended in other closing item 9, fiscal staff recommends items A through E be approved as recommended by the governor. Item F be approved consistent with language included in the 23 Appropriations Act, and items G and H be not approved, as well as requests authority for fiscal staff to make technical adjustments as necessary.
Any questions about this? With that, I'd entertain a motion.
Thank you, Chair. I have a clarification here, so I'll be reading the motion. I do motion to approve fiscal staff recommend, I motion that fiscal staff recommend other closing items 1 and 5 be closed as recommended by the governor. Other closing item 2 contingent upon approval of the major closing issue in the indigent hospital care budget account. Other closing item 3 contingent upon approval of the major closing issue in the upper payment limit budget account. Other closing item 4 contingent upon approval of the major closing issue in the increased quality of nursing care budget account. Other closing item 6 contingent upon approval of major closing issue 2 in the improved healthcare quality and access budget account. Other closing item 7, including budget amendment A25111 3243, contingent upon approval of major closing issue 2 in the prescription drug rebate budget account. And other closing item 8, including budget amendment A251223243, contingent upon approval of major closing issue 1 in the prescription drug rebate budget account. Regarding 2025 Appropriations Act language recommended in other closing item 9, fiscal staff recommends items A through E be approved as recommended by the governor. Item F be approved consistent with language included in the 2023 Appropriations Act, with the stipulation that the $16 minimum is specific to salary, and items G and H not be approved.
Do I have a second?
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. We have a discussion. Senator Titus, go ahead.
Thank you, Madam Chair. Just wanted clarification that all these contingencies will be resolved when we do the final closing?
Senator Titus, thank you for the question. All of these contingencies reflect the interconnected nature of all of the Medicaid budget accounts. Everything seems to be tied to something else. So those items recommended as contingent, generally other closing items 2 through 6 are discussed as major closing issues in the other budget accounts that we will get to this morning.
Great, thank you.
Assemblymember Monroe Moreno.
Thank you, Madam Chair. And I just wanted clarification that the $16 per hour is for wages only. It's not to include benefits. As we've learned during the interim, some employers were doing the $16 for the wage and benefits on top of that. Others were combining the two, but the 16 is strictly for wage only.
I believe that was our intent. And this is consistent with other decisions that we've made with pass-through language to be included in the Appropriations Act at the end. With that, any other further discussion on the motion? All those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving on to the Nevada Checkup Program. This is Budget Account 3178 on page 59 of your closing packet. The Balanced Budget Act of 1997 created the State Children's Health Insurance Program, or CHIP, and is referred to as Nevada Checkup Program in Nevada. There are 4 major closing issues, and generally these major closing issues reflect the decisions made in the Medicaid budget account, and fiscal staff would recommend that these decisions be approved consistent with decisions made previously. Major closing issue number 1 includes Medicaid checkup caseload. Fiscal staff will note that above and beyond the anticipated caseload increases, representing a 5.9% and 11.3% increase, the agency indicated changes to the cost per eligible for Medicaid, for Nevada checkup were included in the updated caseload, which, when combined with standard caseload updates, would generate an additional general fund appropriations of $4.9 million. I'm sorry, $3.5 million in fiscal year 26 and $4.9 million in fiscal year 27, as shown at the table at the bottom of page 60. Reviewing the actual fee-for-service cost as of November 24th, which would have been used, it does appear that there was a correction made to the cost per eligible, again, as reflected in tables at the bottom of page 60. The decision for the subcommittee asked, does the subcommittee wish to recommend approval of updated caseload projections for the Nevada Checkup Program based on March 25 caseload projections and updated FMAP or federal medical assistance rates totaling $30.1 million, $8.4 million in general fund in 26, and $34.8, including $9.8 million in general fund in fiscal year 27.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you. One is great, 2 is better. Moving on to federal medical assistance percentage rates in other major closing issue 2 on page 61 of your packet. The governor recommends $721,625, including $711,079 in general fund over the 25-27 biennium, to account for decreases in the federal medical assistance percentage rate. This is the same information as was provided in Medicaid. The only difference is the updates include technical adjustments to reflect just a revenue swap and removes included expenditure adjustments. This would total $280,877 in fiscal year 26 and $361,464 in fiscal year 27. Does the subcommittee wish to recommend approval of general fund appropriations totaling those same amounts, $280,877 in fiscal year 26 and $361,464 in fiscal year 27, along with matching decreases in federal funds to account for decreases in the federal medical assistance percentage rates projected over the 25-27 biennium when compared to the FY25 legislatively approved rates, including the noted adjustments to correct errors and reflect March 25 caseload updates?
Any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrell-Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving on to major closing issue number 3, or provider reimbursement rate increases. These recommended rate increases align Nevada Checkup Program provider reimbursement rates with provider reimbursement rates recommended in the Medicaid budget account. There are similar adjustments made for mandatory rate increases, which is in M101, totaling $2.6 million and $725,750 in general fund, and $4.6 million, including $1.3 million in general fund in fiscal year 27, to support federally mandated rate increases. Discretionary rate increases, I won't go over these again, they're the same components that were discussed in Medicaid, but community paramedicine is in E266, partial hospitalization services is E271, day treatment services is 272, and inpatient psychiatric and detoxification facility in E273 is option D. There were updates to mandatory rate changes as noted at the top of page 63, reflecting the updated FMAP as well as caseload impacts. And then fiscal staff notes that although the division is not required to align coverage for checkup providers with Medicaid providers, it does so for consistency, and fiscal staff recommends the subcommittee approve or disapprove checkup provider rate increases consistent with its actions in closing the Medicaid budget. And if I flip back very quickly to the rate increase approved on page 31, that would include approval of items B and C and not include approvals of items A and D.
Do we have any questions? Seeing that, I'd entertain a motion.
Thank you, Chair. I will make a motion to be consistent with the actions taken to close the Medicaid budget as stated by staff.
And I'm sorry, Madam Chair, I should read the motion first and then clarify what component it is. I skipped ahead a little bit.
We will backtrack and rescind that motion, and go ahead, Mr. Kazari.
My apologies. Decision for the subcommittee, on the middle of page 63. Does the subcommittee wish to recommend approval of the following rate increases? Decision Unit M101 includes mandatory rate increases totaling $8.9 million, including $2.5 million general fund over the 2025-27 biennium, and discretionary rate increases, including approval of Decision Unit E266, which includes not recommending approval of Decision Unit E266, which is $1.7 million in private hospital provider tax revenue and federal funds over the 25-27 biennium to support rate increases for community paramedicine providers, does include recommended approval of Decision Unit E271, including $144,532 in private hospital provider tax revenue and federal funds over the 25 to 27 biennium to support rate increases for partial hospitalization services, would include recommended approval of Decision Unit E272, which is $38,716 in private hospital provider tax revenue and federal funds over the 25-27 biennium to support rate increases for day treatment services, and would include not recommending approval of Decision Unit E273, which includes $748,139 in private hospital provider tax revenue and federal funds over the 25-27 biennium to support rate increases for psychiatric and detoxification facility services.
Now we are ready to entertain that motion.
Yes, thank you, Mr. Kucera. Thank you, Chair. I will now motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrell-Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. I thought I was going to get away without reading one of these large boxes. Other major closing issue number 4 is applied behavior analysis rates. At the bottom of page 63, Governor recommends $17,052, including $4,812 in general fund, to increase rates for applied behavior analysis services. Again, to be consistent with the decision made in major closing issue 5, the recommendation is as follows: for the subcommittee to not recommend approval of $17,052, including $4,812 over the 25-27 biennium, to support changes to applied behavior analysis rates consistent with actions taken in major closing issue 5 in the Medicaid budget account.
Do we have any questions? Seeing none, all those in, I'd entertain a motion. Look at that. I jumped way ahead.
I motion to approve as stated by staff.
Second.
A motion from Assemblymember Mosca, a second from Senator Don Darrell-Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving on to major closing issue number 5, our service expansions. Again, I won't reiterate this discussion was had in Medicaid, but this includes mobile crisis, assertive community treatment, first episode psychosis, and expansions to services provided to the juvenile justice services budget. To be consistent with Medicaid options approved on page 37, the recommendation here is as follows at the top of page 65. Does the subcommittee wish to recommend approval of the following service expansions as recommended by the governor, consistent with actions taken in major closing issue 6 within the Medicaid budget account? To approve decision unit E258, including $1.2 million in private hospital provider tax revenue and federal funds over the 25-27 biennium to fund expanded mobile crisis services. Approval of decision unit E260, including $593,003 in private hospital provider tax revenue and federal funds over the 25-27 biennium to fund expanded coverage for assertive community treatment services. Approval of decision unit E274, including $342,759 in private hospital provider tax revenue and federal funds over the 25-27 biennium to fund expanded first episode psychosis treatment. And approval of decision unit M504, including $88,911 in private hospital provider tax revenue and federal funds over the 25-27 biennium to fund expanded services to the juvenile justice population.
Do we have any questions? Seeing none, I'd entertain a motion.
A motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving on to other closing items on page 65. We'll note Budget Amendment A25, 453, 3178 was discussed in major closing issue 6 and includes corrections to the total amount of general fund related to the implementation of statewide managed care. Otherwise, the other closing item motion at the top of 66 reads, fiscal staff recommends other closing item 1 be closed consistent with action taken in major closing issue 9 within the Medicaid budget account. Other closing item 2 be closed consistent with actions taken in major closing issue 2 within the improved healthcare quality and access budget account with the noted technical adjustments. Other closing item 3, including Budget Amendment A25, 453, 3178 be closed consistent with major closing issue 8 within the Medicaid budget account and request authority to make technical adjustments as necessary.
Do we have any questions? Seeing no questions, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving to the Medicaid Administration Budget Account 3158, starting at page 67 of your packet. We'll skip right to major closing issue number 1, are a series of positions recommended associated with federal mandates. The governor recommends $4.2 million, including $1.8 million in general fund and 7 decision units to support 16 new positions. Details provided on the following pages are broken up by section, the first of which includes home and community-based services and M503 to support 5 positions, including 1 social services manager, 1 social services chief, healthcare coordinator, social service program specialist, and 1 administrative assistant position to improve Medicaid services by setting standards for quality of care within home and community-based services. Position descriptions are noted at the bottom of page 68 and page 69. Updated information provided by the agency notes that it's not untypical or not unstandard to include this level of supervision for a team within the Nevada Medicaid budget account, and additionally reiterated the need for high-level supervisors to ensure federal requirements for home and community-based waiver recipients are met. Item B is juvenile justice service expansion. This would be the administrative component of the services just approved in Medicaid and checkup, and fiscal staff would recommend these be approved consistent with those decision units. Federal compliance and appeals in M505 includes $389,837, including $194,918 in general fund for 2 positions to support compliance and appeals activities. According to the agency, it must maintain staff to represent the state's position at administrative hearings, and these are required to keep up with both participant and provider fair hearing requirements. The agency noted is currently meeting all requirements, but that due process is important, and this process is not moving quickly enough. Moving to option D on page 70 is provider screening enrollment, decision unit M506. Governor recommends approximately $392,000, including approximately $196,000 in general fund, to fund 2 positions to support provider screening and enrollment activities. The agency indicated additional resources are required to maintain federal compliance, and that the number of providers enrolling has increased 47% since 2019, and the agency has also experienced an 84% increase since 19 in moderate and high-risk providers, which require additional screening. There was additional information provided in follow-up, noting that it's difficult to keep up with revalidations, and additional resources would allow Medicaid to keep up with the increased volume. Cybersecurity is item E on page 70, is M507. We request 3 positions and associated expenditures to support additional IT security team resources. These positions and components are discussed on 70. There was an update that clarified the intent of the IT professional position would be to support state cybersecurity risks, and then it would report to the IT manager. Additionally, the recommended analyst would be responsible for working with IT team and vendors. Section F is the State Consumer Advisory Commission is M510. The governor recommends approximately $153,000, including $77,000 approximately in general fund appropriations for 1 administrative assistant position and associated expenditures to support federally mandated activities related to the State Consumer Advisory Commission. Item G is M512 is the EQRO, or the External Quality Review Organization support, which includes $1.2 million, including approximately $615,000 in general fund appropriations over the biennium to fund 1 social services program specialist position, associated expenditures, and contract costs to support the statewide expansion of managed care, which was discussed in Major Closing Issue 8 just a little while ago. According to the agency, the governor recommends these additional positions to assist with CMS or Federal Center for Medicare and Medicaid Services required monitoring. In follow-up information, the agency testified it anticipates onboarding a 5th managed care organization, and these resources are required for that purpose. In summary, on page 72, the following sections, A, B, and F, are recommended as a result of new or amended federal rules. Sections C, D, and E are recommended to maintain federal compliance. Section G is recommended as a companion decision unit to the expansion of statewide managed care. And item B is recommended as a companion decision unit for the juvenile justice expansion previously approved. The motion on page 73 is as follows. Does the subcommittee wish to recommend approval of 1 or more of the following decision units? A, decision unit M503 is $1,504,085 in general fund over the 25-27 biennium to fund 5 positions to support home and community-based waiver programs. B is decision unit M504 is $374,452 in federal funds and provider tax revenue transfers over the 25-27 biennium to fund 2 healthcare coordinators, grade 34, and associated expenditures to support the expansion of Medicaid services to the juvenile justice population, contingent upon approval of major closing item 6 in the Medicaid budget account. Decision unit M505 is $389,837, including $194,918 in general fund over the 25-27 biennium to fund 1 social services program specialist, grade 37, 1 legal resource assistant, grade 35, and associated expenditures to support federal compliance and appeals activities. Decision unit M506 is $391,747, including $195,873 in general fund over the 25-27 biennium to fund 2 social services program specialists at a grade 35 and 37. Associated expenditures to support provider screening and enrollment. Decision unit M507 is $677,375, including $191,679 in general fund over the 25-27 biennium to fund 3 positions. Associated expenditures to support additional IC security team resources. F is decision unit M510 is $153,033, $76,515 in general fund over the 25-27 biennium to fund 1 administrative assistant position at a grade 27. Associated expenditures to support federally mandated activities related to Medicaid Advisory Committee and Beneficiary Advisory Committee activities. And decision unit M512 is $1.2 million, $614,503 in general fund over the 25-27 biennium to fund 1 social service program specialist, grade 35, associated expenditures, and vendor contract costs to support the statewide expansion of managed care contingent upon major closing issue 8 in the Medicaid budget account.
Do we have any questions? Seeing none, I'd entertain a motion.
Thank you, Chair. Knowing our current budget environment, I do have an alternative motion here. I will recommend approval of item A, M503, item B, M504, item E, M507, item F, M510, and G, M512. In addition, I'll recommend approval of item C, M505, excluding 1 social services program specialist position, and recommend approval of item D, M506, excluding 1 social service program specialist position, grade 37.
Do I have a second?
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries unanimously.
Thank you, Madam Chair. Apologies for the disruption. Moving on to major closing issue number 2 is position changes not associated with federal mandates. The governor recommends a net $3.8 million, including $1.4 million in general fund, inclusive of transfers, and 11 decision units to fund 8 new positions, the continuation of 10 positions funded with ARPA funds, 1 contract position, and 1 transferred position. Item A is the single preferred drug list administrative component, which was previously approved, and fiscal staff recommend these positions be approved consistent with items decided in the Medicaid budget account. The update includes Budget Amendment A25, A26, 3158, which includes a additional $1.2 million in general fund over the biennium to account for the state share of prescription drug rebate revenues. As amended, expenditures would total $3.3 million, including $1.2 million in general fund over the 25-27 biennium. This component, the general fund, is included in a Medicaid budget amendment, but is included here for reference. Item B is non-emergency medical transportation. The governor recommends $685,092, including approximately $343,000 in general fund to fund 1 new social services program specialist and associated expenditures to support non-emergency medical transportation services to strengthen the state's delivery model, ensuring Medicaid participants have access to this required benefit. The hearing, discussion, and update on this item indicated that the current vendor is struggling to meet the needs of both urban and rural participants while relying heavily on ride-share companies. Moving on to item C, at the top of page 76 is the continuation of oral health programs is a net $30,111, including approximately $77,000 in general fund to continue funding for 3 positions and associated expenditures supporting the oral health program. According to the agency, this grant period will end at the end of August 2026, and general fund appropriations are requested to cover the state match to continue these services over the coming biennium. The agency indicated it had obtained a related grant to support oral health services. However, those services, that grant is not eligible to support expenditures as recommended in this decision unit. Item D is workforce development, is E262 and E903. So this is very similar to the Medicaid component. The governor recommended $200,000 approximately in federal revenue and transfers from the prescription drug rebate budget account to fund 1 management analyst and associated expenditures to support workforce development activities. And additionally, the governor recommends the transfer of 1 management analyst position from the Office of Science, Innovation, and Technology, along with the $8.5 million in general fund appropriations to support infrastructure grant activities for graduate medical education and workforce development. Moving to the update on the top of page 77, the agency indicated and provided information distinguishing these 2 programs. Decision unit E262, again, is intended to supplement local match provided by counties, which would expand the current supplemental program to address the increased need of general fund, to address the increased cost of services reflected in providing medical services in a teaching environment. The second component is a transfer from the Office of Science and Innovation Technology, which supports infrastructure, increasing residency slots and other components, and has traditionally been a grant program. 903 would transfer that 1 position to continue to support this program. Budget Amendment A25, 805, 3243, as discussed in the prescription drug rebate account, includes associated adjustments to general fund to cover the state share of services. Moving to item E is the behaviorally complex care services is E275, recommends $227,471 in federal funds and provider tax revenue transfers over the 25-27 biennium to fund 1 management analyst position and associated expenditures to support the expansion of the behaviorally complex care program as discussed in the Medicaid budget. Staff training is item F is E303. Governor recommends $514,697 in federal revenue and transfers from prescription drug rebate revenue over the biennium to support 1 training officer position and associated expenditures. In an update, including Budget Amendment A25, 805, 3243, as discussed in Major Closing Issue 3 in the prescription drug rebate account, would not change total expenditures for this decision unit, but would increase general fund appropriations by $257,348 to reflect the state share of services. Item G is the continuation of American Rescue Plan Act positions, which includes the elimination of $1.9 million in coronavirus ARPA funds over the 25-27 biennium, and includes the addition of $2.1 million, including approximately $717,000 in general fund to continue funding for these 7 positions. These are general, fiscal, and administrative components, and also includes 1 unclassified pharmacist position. 6 of the 7 positions were filled that are continued As of the time of the hearing, 6 of the 7 positions recommended to be continued are currently filled, and updated provided by the agency reiterated the duties as noted in the prior page and confirmed the ongoing need for all associated positions. Item H is contracted dental hygienist in E312, which originally included federal and opioid funds. However, in follow-up information and during the hearing, the agency clarified that funding for this position should be tobacco settlement funds in Fund for a Healthy Nevada, not opioid funds in Fund for a Resilient Nevada. The Department of Health and Human Services clarified that this funding is available in the 3195 is the Grants Management Unit budget account and could be transferred, and fiscal staff recommends an associated technical adjustment to correct the revenue sources. The very large motion on page 80, as I take a deep breath for this one. Does the subcommittee wish to recommend approval of one or more of the following decision units? A is Decision Unit E252, including adjustments in Budget Amendment A25, 82, 826, 3158, total funding of $3.3 million in federal funds and transfers from the prescription drug rebate budget account over the 25-27 biennium to fund 3 positions, associated expenditures, and contractual expenditures to support the development of a single preferred drug list contingent upon approval of major closing issue 2 in the prescription drug rebate account. And Decision Unit E253 is $685,092, including $342,547 general fund over the 25-27 biennium to fund 1 new social services program specialist grade 35 associated expenditures and contractual expenditures to support the non-emergency medical transportation program. Decision Unit E255 and E491 is a net $30,111, including $76,599 general fund in fiscal year 27 to continue funding for 3 positions and associated expenditures supporting the oral health program. Decision Units E262 and E903 include $200,488 in federal revenue and provider tax revenue transfers to fund 1 management analyst grade 37 and associated expenditures to support workforce development initiatives and general fund appropriations transfers of $313,018 over the 25-27 biennium to transfer 1 position from the Office of Science, Innovation, and Technology to administer the graduate medical education program contingent upon approval of major closing issue 10 in the Medicaid budget account. Decision Unit E275 is $227,471 in federal funds and provider tax revenue transfers over the 25-27 biennium to fund 1 management analyst grade 37 and associated expenditures to support the expansion of the behaviorally complex care program contingent upon approval of major closing issue 4 in the Medicaid budget account. Decision Unit E303 is $514,697 in federal revenue and provider tax revenue transfers to support 1 training officer grade 36 associated expenditures and $324,242 in training expenditure over the 25-27 biennium. Decision Units E499 and E599 include elimination of $1.9 million in American Rescue Plan Act coronavirus state fiscal recovery funds and the addition of $2.1 million, including $716,940 in general fund over the 25-27 biennium to continue funding for 7 positions. Finally, Decision Unit E312 is $451,008 in federal funds and Fund for a Healthy Nevada tobacco settlement fund transfers to support 1 contracted dental hygienist position and associated expenditures, including the noted technical adjustment to correct the revenue source.
That was a lot. Do we have any questions? Seeing none, I'd entertain a motion.
Thank you, Chair, and here I will make an alternative motion. I do recommend, I motion to approve the recommendation of approval of item A, item C, item E, item F, item G, and item H. I do not recommend approval of item B. And on item D, do not recommend approval of Decision Unit E262, but do recommend approval of Decision Unit E903.
Everyone catch that? Do I have a second?
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Any further discussion on that alternative motion that was just explained? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously. And before we move on to the next closing issue, I just kind of wanted to take a time to have a further discussion. I know that as we've been going through, we're nearing the end, so I don't want to prolong it too much, but I think it's really important to get this on the record. I think it's been very clear that we've had a lot of challenges with this budget and trying to come up with a lot of adjustments, and I appreciate our staff and I appreciate the GFO and Medicaid staff working to get these budgets in a place where we are today. So I really appreciate that. But given that, I do know that this agency and this division has a real struggle. It's arguably the largest portion of our state budget deals with Medicaid. I think we're hovering around 60%. And I know they have like one person over there being able to manage all this. And I think that leads to, errors, unforced errors, and things where we could be more efficient and we could maximize rebates, we can maximize any of these things. And so with that, I know we've been having conversations not only in committee, but I know committee members have also been having those conversations about what we can do to make our state more efficient, make it work for us. And so with that, I would entertain an additional set of motions and positions that are not associated with the governor's recommendations, but we think are needed in order to move forward with this agency. And with that, I will turn this over unless anyone has any further discussions on that. Seeing none, I'd entertain a motion.
Thank you, Chair. With that, I will motion to recommend first approval of $500,000, $250,000 general fund each year of the 2025-27 biennium to fund contracted fiscal and related support for the Medicaid program. 2, recommend approval of approximately $132,000, $66,000 general fund each year of the 25-27 biennium to fund a contracted chief economist position to support Medicaid caseload and revenue projections and associated analysis. 3, recommend approval of approximately $144,000, $72,000 general fund each year of the 2025-27 biennium to fund a contracted chief economist position to support Medicaid caseload and revenue projections and associated analysis. And finally, 4, recommend approval of approximately $186,000, $93,000 general fund in FY 2026 and approximately $234,000, $117,000 general fund in FY 2027 to fund a fiscal audit team, including 2 management analyst positions, grade 37 and grade 39, and associated expenditures to provide pre- and post-audit services and associated activities in the Medicaid administration budget account.
Second.
Yes, 1 second, staff's asking for a clarification on the motion. Go ahead.
Thank you, Madam Chair. I believe based on our prior conversation, and this is honestly just a typo on this component, there was a recommendation for a chief economist totaling $132,000. I believe the intent of the third component would be a contracted administrative services officer 4 position and not a chief economist position. So I apologize for that duplication there.
And is that the intent in making your motion?
That is the intent. Thank you.
Okay. You know what? I'd hate to make you read all that over again. Do we think that's clear for the record? We're just going to make a clarifying motion here, just to make sure that this is abundantly clear since this is new. Yes. So I'm going to have you, Assemblymember Mosca, redo your motion. Redo your third part of the motion.
Yes, thank you. Yes, thank you so much for that help. I appreciate it. So I will clarify number 3, or I will change number 3. Should be recommended approval of approximately $144,000, $72,000 general fund each year of the 2025-27 biennium to fund a contracted administrative service officer 4 position to support Medicaid caseload and revenue projections and associated analysis.
Second.
I'm sorry, I'm going to have you clarify that again because I think that position is actually to provide high-level senior budget analysis and support.
Okay, thank you, everybody.
Okay, try
I'll do it
number 2.
One more time,
Okay, here we go.
okay. So I recommend approval of approximately $144,000, $72,000 general fund each year of the 25-27 biennium to fund a contracted administrative service officer 4 position to provide high-level senior budget analysis and support.
Do I have a second?
I was waiting. Second.
Thank you. I just wanted to make sure we got that clear. We have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Do we have any further discussion? Go ahead, Senator Titus.
Thank you, Madam Chair. Just need clarification on a couple things, frankly. The total amount that we just did in that motion of total amount of general fund dollars, is that correct?
I'm going to count it up for you really quickly if you can just stand by. Do we
Great.
have any other further questions while
Yes,
you're asking that?
a total number of personnel that we just added. And 3, these are all contracted personnels.
Except for the fiscal audit team. Hold on one second. I'll get you those numbers and we'll be able to answer all 3 of those questions for you just shortly.
Just trying to keep my red pen available, and so
Senator Titus, I'm still working on the total amount, but I'll give you the general fund amount because I think that's probably the one you're most concerned about. There are 3 contract positions. That would be for the recommendation of the contracted support for fiscal, technical assistance, cost allocation, and maximizing the utilization of federal resources. Additionally, the contracted staff position, the second one would be the chief economist position to assist with caseload and revenue projections. And the third one, contracted position, would be the administrative services officer 4 position to provide high-level senior budget analysis and support. Our thinking and the discussions that at least I've had, not only with our LCB nonpartisan fiscal staff, but also with the agency, was that we are having a difficulty and we need some maybe more specialized contract staff that has done this in other states to be able to come in and be able to help us maximize and utilize some of these caseload and revenue projections that we've clearly seen struggled with. So, and then the 2 full-time FTE positions that are not contract would be a part of that fiscal audit team, which would include those 2 management analyst positions, grade 37 and 39. So 3 contract, 2 FTEs. As far as the general fund allocations to fund all of those positions, the general fund allocation, and mind you, that is in a lot of these positions half, so it's a 50-50 split, would be $986,000 in general funds. So $986,000.
follow up if I might, Madam
Go
Chair.
ahead.
So that leads me to 2 additional questions. Knowing that there's been vacancies, et cetera, are these folks available at this time?
what my understanding in those conversations, and we can always call Ms. Weeks up to the table if you'd like. I know part of our thinking and discussions were the need to bring in some outside people, and some of these additional resources would be able to. I believe she has someone in mind, so if you don't mind coming up to the table to answer that question, I think that would be helpful for our committee.
Chair Committee Member Stacy Weeks, the record. Yes, the goal here is to help get people from out of the state, to help support the expertise in our team and to train our staff so we can better prepare the budget and make sure that we have all the resources we need to maximize federal resources. Actually, our fiscal team right now is almost fully staffed. We have a vacancy rate of 5%, almost beating DeWiss, and Administrator Thompson probably, and we have a little bit of a competition, but we actually are filling our positions and excited to keep growing and ensure that we can support our budget. Thank you.
And final question, if I might, with the fiscal uncertainty of the federal government's reimbursement, is this something that this other 50%, do you anticipate there being any issue with this, then the federal government covering their half?
Chair Committee Member Stacy Weeks, the record, not for the 50-50. My understanding is there are discussions about the 90% federally funded staff, which we have very limited number of, or positions. It's mostly technology that we're worried about losing that funding.
Thank you, Director, and thank you, Madam Chair.
I know this is a big change, so does anyone have any other further discussion or questions on the motion on the table right now? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously. Thank you, Mr. Kucera, for that break, and I will let you continue.
Thank you very much. I appreciate the breath. Major closing issue number 3 is the Nevada HealthLink eligibility determination, continuing on page 81 of your closing packet. The governor recommends $33.4 million, including approximately $306,000 in general fund in fiscal year 26, and $33.5 million, including approximately $348,000 in general fund in fiscal year 27, to fund 14 positions, associated expenditures, and contractual expenditures to automate Medicaid enrollment through Nevada HealthLink. This recommendation, as discussed previously, includes $7 million in prescription drug rebate revenue, of which approximately 67% is required to be returned to the general fund. There'll be some additional information provided in follow-up, but as recommended by the governor, this decision unit includes 14 positions that are noted at the middle of page 81. According to the agency, recommended positions would support Medicaid IT needs and integrations with Nevada HealthLink. There are contractual expenditures in the governor's recommended budget totaling $32 million in 26 and $31.8 million in 27. However, most of this funding is being provided at a 90-10 match for the implementation of an MIS or related system. At the top of page 82, ongoing expenditures to support the operation of an approved and updated system is typically reimbursed at a 75-25%. According to the agency, the modernization would allow consumers eligible for Medicaid to enroll with no-touch processing within minutes through the exchange's online technology platform. And as noted previously, this implementation would impact the modified adjusted gross income, or the MAGI population, which according to the agency represents 80 to 90% of those eligible for Medicaid. Those who are eligible through other determination factors, such as non-income-based eligibility determinations, would continue to receive support through the Division of Welfare and Supportive Services. Speaking of, the Division of Welfare and Supportive Services is currently responsible for all Medicaid eligibility. A significant portion of their staff is funded by cost allocation revenue that is supported by Medicaid eligibility. However, the Division of Welfare and Supportive Services does implement other programs and determines eligibility for a variety of other programs, including the Supplemental Nutrition Assistance Program. Applications for Medicaid are submitted through the division's central application portal, which allows applicants to complete a single high-level questionnaire. It is unclear how the recommendation to move responsibility for Medicaid eligibility to Nevada HealthLink would impact the streamlining efforts, such as the no wrong door approach. Additionally, as discussed in the February 27th and in post-hearing update information, it is also unclear the impact to Division of Welfare and Supportive Services staff if 80 to 90% of the Medicaid population were to be determined eligible or receive eligibility determinations through this proposal. The division reiterated that it anticipates reduced needs for caseworker staffing could be adjusted through attrition as well as updates to Medicaid's cost allocation plan with the Division of Welfare and Supportive Services. However, exact impacts to staffing in DWSS are not known. Budget Amendment A25, A26, 3158, also mentioned in Major Closing Issue 2, would delay the start date of this project from July 25 to January 26, which includes reductions in associated contracts and vendor expenditures. 14 positions would remain, but many of them are pushed back to start in either October, August, or October of 25, August of 26, or October of 26. This budget amendment would decrease expenditures by approximately $16.7 million with a $403,000 approximate general fund decrease. In total, considering this budget amendment, as well as additional components in the Medicaid account to offset the state share loss of rebate revenue, expenditures needed to support this initiative would total $50.2 million, including $5.5 million in general fund over the biennium. The agency confirmed reduced expenditures and recommended adjustments would not delay the implementation date of January 27 to begin enrolling Medicaid participants for the 2027 plan year. Given the uncertainty in total ongoing costs, as well as unknown impacts to the Division of Welfare and Supportive Services, the subcommittee may wish to issue a letter of intent directing both the Division of Healthcare Financing and Policy and the Division of Welfare and Supportive Services to provide a report to the Interim Finance Committee by July 1, 2026, outlining the implementation progress made, the total anticipated ongoing cost for the future biennia, fiscal year 28 and 29, as well as anticipated and or actual impacts to staffing. The decision at the middle of page 84 is as follows. Asked if the subcommittee wished to recommend approval of $16.9 million, including $48,812 general fund in fiscal year 26 and $33.2 million, including $202,734 in general fund in fiscal year 27, to fund 14 positions, associated expenditures, and contractual expenditures to automate Medicaid enrollment through Nevada HealthLink. And does the subcommittee wish to recommend the issuance of a letter of intent directing both the Division of Healthcare Financing and Policy and the Division of Welfare and Supportive Services to provide a report to the Interim Finance Committee by July 1, 2026, outlining the implementation progress made, the total anticipated ongoing system costs for 28 and 29, fiscal years 28 and 29, as well as the anticipated and or actual impact to staffing in the 25-27 biennium, as well as the 27-29 biennium.
Do we have any questions? Seeing none, I'd entertain a motion.
Thank you. I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator John Darrell-Loop. Do we have any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Moving on to Major Closing Issue 4 on page 84 of your packet is the reorganization of the Department of Health and Human Services. As heard during the Department of Health and Human Services Director's Office hearing on February 6th, the Governor recommends $9.2 million, including $3.7 million general fund, over the 25-27 biennium, including transfers to reorganize the Department of Health and Human Services and establish the Medicaid Administration budget account as the Director's Office for the proposed Nevada Health Authority. The major issue is being added to the subcommittee closing document for consideration of the reorganization components, technical adjustments, and amendments located within the Medicaid Administration budget account, all of which are considered contingent upon approval of BDR 1116 or other enabling legislation. The table at the top of page 85 outlines all of the personnel components included within the governor's recommended budget related to the establishment of the Nevada Health Authority. In total, this includes 22 positions, several transfers, additional positions, and reclassifications. There are adjustments and budget amendments relevant to this decision unit, including Budget Amendment A25 782 3158, which was submitted by the Governor's Finance Office on March 31st, and would transfer 3 administrative positions, including an unclassified deputy administrator, an administrative services officer, and an accounting assistant, from the Healthcare Facilities Regulation budget to the Medicaid Administration budget account. There's an associated budget amendment that was approved by the full money committees during the DPBH Division of Public and Behavioral Health's closing on April 26, which correctly aligned the pitchers and catchers for those positions. Budget Amendment A25 805 3243 was submitted by the Governor's Finance Office and includes general fund appropriation increases in the Medicaid budget account by $1.3 million over the biennium to account for the loss of offsetting general fund revenue. Again, this is including consideration for the state share and the federal return of rebate revenues, as discussed in Major Closing Issue 3 in the prescription drug rebate budget account. There is a technical adjustment recommended in E281. It was discovered that general fund appropriations were overstated by approximately $625,000. The agency concurs with this recommended adjustment, and in total, Decision Unit E281 would total $2.8 million, including a 50% general fund match at $1.4 million. Budget Amendment A25 870-3158 was submitted by the Governor's Finance Office on April 24th and would decrease expenditures by approximately $58,000, including a 50% general fund decrease over the 25-27 biennium to change 2 deputy director positions to division administrator positions in Decision Unit E282 and 286. When consideration of all of these technical adjustments, submitted budget amendments, the proposal within the Nevada Medicaid budget account, the Nevada Administration budget account, would total $10 million, including $3.5 million in general fund over the biennium, and include the addition of 25 positions and associated expenditures. And again, totals as presented represent only the expenditures within the Nevada Medicaid Administration budget account and do not include associated decision units which may be approved in other budget accounts, including the noted $1.3 million in general fund appropriations in the previously mentioned budget amendment. This major closing issue, associated components of all the budget amendments should be approved contingent upon BDR 1116 or other enabling legislation. Decisions pertaining to unclassified positions will be considered in the pay bill. Decision at the top of page 86 asks, does the subcommittee wish to recommend approval of $10 million, including $3.5 million general fund, over the 25-27 biennium, inclusive of transfers, to reorganize the Department of Health and Human Services, establish the Nevada Health Authority, including associated components of budget amendments A25, 782, 3158, A25, 805, 3243, and A25, 870, 3158, identified technical adjustments, and contingent upon approval of Bill Draft Request 401116 or other enabling legislation, and also consistent with the 25 pay bill.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Any further discussion on this motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Seeing none, the motion passes unanimously. I'm also going to take another little moment before Mr. Kucera goes to talk about the need for a potential additional position that we would like to add to support the Nevada Health Authority. Currently, right now, as recommended by the governor, there is one deputy director that is proposed under the Nevada Health Authority. And that deputy director currently would be in charge of like healthcare financing. In talking with Ms. Weeks and talking with Director Whitley, we think given this and given the fact that it's consistent with DHHS that has multiple deputy directors, that the addition of a additional deputy director position to support the Nevada Health Authority would be appropriate. It's my understanding that that person would be in charge of community and stakeholder engagement and workforce development, overseeing a lot of the workforce fund agency advisory committees, legislative interaction, and also the Office of Mental Health. I think that this is a necessary position to help support the Nevada Health Authority as it moves forward. And I think ultimately this will help all of the community members involved in, again, running this more efficiently. So with that, I would entertain a motion.
Thank you, Chair. Based on that, I will make a motion to recommend approval of approximately $194,000, $97,000 general fund in FY 2026 and approximately $242,000, $121,000 general fund in FY 2027 to fund an unclassified deputy director position and associated expenditures to support the Nevada Health Authority.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Daraloop. Any further discussion on this motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Now, Mr. Kucera, I will turn it back over to you again.
Thank you very much for the break, Madam Chair. I appreciate it. Other closing items are on page 86 and page 87. These are similar items that will be discussed or have been discussed in major closing issues. There are a couple base budget technical adjustments that correct personnel adjustments or transfers between pitcher and catcher accounts as reviewed by in consultation with the agency. The motion at the bottom of page 87 includes fiscal staff recommends other closing items 1 through 4 be closed as recommended by the governor. Other closing item 5 be contingent upon approval of major closing issue 7 in the Medicaid budget account. Other closing item 6 contingent upon approval of the major closing issue in the increased quality of nursing care budget account. Other closing item 7 contingent upon approval of major closing issue 6 in the Medicaid budget account. Other closing item 8 contingent upon approval of the major closing issue in the IGT Intergovernmental Transfer Program budget account. Other closing item 9, including the noted technical adjustments, as well as technical adjustment authority as necessary.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
A motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries unanimously.
Thank you, Chair Wynn. Moving on to public option budget account 3164, starting on page 89 of your closing packet, there's a single major issue, which is the continued implementation of the public option. The governor recommends the continuation of the previously improved base expenditures, including 5 permanent positions, as well as an additional $1.6 million in general fund appropriations over the 25-27 biennium to support actuarial costs. In total, general fund appropriations as recommended include $2.4 million in each year of the biennium. There's significant discussion on pages 90 and 91. I'm going to do my best to boil this down. The implementation of the public option as approved by the Federal Centers for Medicare and Medicaid Services and other associated federal agencies include funding in a waterfall fashion that includes first funding that would be dedicated towards a premium reduction program. Secondly, would go towards a reinsurance component. And then third, a market stabilization program, which, if funding is available after funding for the premium relief and reinsurance programs, would fund a quality incentive payment program and practice in Nevada incentive programs. The table at the bottom of page 91 was taken from the actuarial analysis, which shows the actuary projected pass-through funding, associated costs of those different program components, as well as the cumulative remaining funding. The agency, as well as the approved waiver, indicated the intent is to fund administrative costs with federal pass-through funding as it becomes available in future biennia. However, the need for general fund appropriations, according to the agency in this current biennium, is still needed. In follow-up information, while the federal waiver was approved based on projected federal pass-through funding, it is still an estimate, and actual figures would be based on plan year 26 data, enrollment, and final premium rates. This is on page 92 in the update section. Additionally, these final rates require review by a contracted actuary as approved by the federal CMS. And it is common budgeting practice to include estimates or projections. However, pursuant to NRS 695K, funding to support the public option must be deposited in the Public Option Trust Fund, which is administered by the State Treasurer's Office, which is non-executive budget account 1100. Statute also requires the State Treasurer to make a determination if sufficient funding is available to administer the public option before any funding can be expended on programmatic activities to increase the affordability of the public option. While this budget account 3164 was established and funded directly with general fund appropriations in the prior legislative session, no programmatic activities were funded, and all general fund appropriations were used to fund administrative and preparatory activities. However, the anticipated receipt of federal pass-through funding necessitates the utilization of this non-executive 1100 budget account. Federal pass-through funding may be transferred to the public option budget account, again 3164, within Medicaid, and programmatic expenditures subject to the work program review requirements. The subcommittee may also wish to recommend the issuance of a letter of intent instructing the agency to provide a report to the Interim Finance Committee upon the first receipt of federal pass-through funding, and by August 1st, 2026, identifying the projected amount of funding, as well as other program components. Fiscal staff will note if it's the subcommittee's desire to keep a separate operating budget and make direct general fund appropriations to the 3164 budget account. There's a recommendation to include back language in the 2025 Appropriations Act, indicating that the public option budget account is to receive direct general fund appropriations, notwithstanding the requirements of NRS 695K. The motion at the top of page 93 asks if the subcommittee wishes to recommend approval of general fund appropriations totaling $2.4 million in each year of the 25-27 biennium to support administrative expenditures for the public option, with language added to the 25 Appropriations Act indicating the public option budget is to receive direct general fund appropriations, notwithstanding NRS Chapter 695K. And if recommended for approval, the subcommittee may wish to recommend the issuance of a letter of intent instructing the agency to provide a report to the Interim Finance Committee upon the first receipt of federal pass-through funds and by August 1st, 2026, identifying the projected amount of funding to be replaced over the 25-27 biennium, anticipated or actual program expenditures by component, as well as public option statistics, such as the number of available plans and enrollment.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop, and it looks like we have discussion from Senator Titus.
Thank you, Madam Chair. I will be a no on this item. I have grave concerns about the public option. I appreciate Director Weeks' work on it and the waiver that she has gotten approved, but I cannot fundamentally support it. Thank you.
Do we have any other further discussion on this? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. We have a nay from Senator Titus and a nay from Assemblymember Dickman. Oh, and we have a nay from Senator Stone. And the motion carries. And before we move on to that next item, I did want to have a little bit further discussion. Obviously, the public option is a part of our law, so I recognize that some of the members may not support it, but it is currently our law, and it is currently in statute. So I, for one, want to make sure that anything that is currently in law is successful. And with that, in talking with Ms. Weeks, I know she put a lot of work in getting that approval from to move forward with the public option. And in talking with her, similar to we have, I think there is the need for some additional support to make sure that we are able to do so, continue to oblige by state law. So I would entertain a separate motion. And before that, do we have any other questions or comments regarding this? Seeing none, I'd entertain that alternative motion.
Thank you, Chair. Based on that, I will make an additional motion I motion to recommend approval of federal pass-through funding to support an unclassified agency manager position for the public option budget account beginning January 1st, 2026, with an annual salary of approximately $151,108, and finally, recommend approval of general fund appropriations totaling $250,000 in each year of the 2025-27 biennium to fund additional vendor support for the public option budget account.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Do we have any further discussion on the motion? Do you want to say? Senator Cannizzaro.
Thank you, Madam Chair. And I am obviously in support of this motion. I think it's important for us to make sure that we are supporting what I think you correctly identified is the current law in Nevada. The public option is something that I think has been a little bit of a labor of love for me in this building. And so to sort of see it come to fruition here, and it is happening. And so I think the idea that we are just going to fundamentally disagree about a bill that did pass and elect not to fund it seems disingenuous, because this is not something that whether or not we fund or do not fund the support for means that it is or is not happening. The public option is the law in Nevada. We are going to be providing these plans to folks. And I am excited because I think since the inception of this bill and the idea behind it, we have thought about how it is that we can best utilize the state's purchasing power to help buy down costs for Nevadans, to provide more affordable health insurance, to provide health insurance that actually provides real coverage for services that Nevadans need. And that model in the public option is working. We have plans that are going to be available to folks, that are going to be affordable, that are going to allow them to actually access health care. And that is something that I think we not only owe to Nevadans, but something that we have now seen as a model works. And it's interesting because we are also having those conversations with a lot of support from folks for other things that we're considering this legislative session, including the creation of the Nevada Health Authority, how it is that we utilize the state's purchasing power to help buy down costs for consumers and make sure that Nevadans have access to affordable health care. It is meaningful and it matters. And so for me, I appreciate this additional motion because we do need to have the support within the agency. I would note that when we went through with the waiver process, one of the requirements through the federal government was to do the premium buy down program so that we could have premium support for individuals who might have that slight increase. That is something that will be funded through pass-through dollars available with implementation of the public option in future biennia. So this general fund would not be needed, I believe, in the next future biennia, but to be able to support that and make sure that this is set up for success for something that we are doing, it is happening, I think is really important. And so I appreciate the committee's consideration and everybody's work to bring this to fruition, and obviously would encourage support of this motion because I think that it is just the little bit that we'll need this biennium to help make sure that we support this, and in the future we'll be supported with those federal pass-through dollars that we're able to draw down.
Thank you. Just to reiterate this, I think it's really important that not only do we support the people, it's not like if we didn't fund this position, the work wouldn't get done. It would just be on the backs of people that are already overworked and having to do this. So I think that this is an appropriate motion, and I am also supportive of it for that reason as well. But with that, I don't see any further discussion. So I would, go ahead, Senator Titus.
Thank you, Madam Chair. I appreciate the chair's comment and majority leader's comment. I'm going to be respectfully disagree and still be a no on this one. I don't think in the long run we will be able to afford this at all. I do not believe it will give us more affordable care or even access to care. So I'm going to continue my nay. Thank you.
Thank you. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. We have nays from Senator Stone, Senator Titus, Assembly Members Dickman, Hibbets, and Hafen. And with that, the motion does carry, and we will move on to our next item.
Thank you, Madam Chair. There's a single other closing item relating to Appropriations Act language. The 23 Appropriations Act included language that allowed the public option budget to balance transfer general fund appropriations between fiscal years. This option was not utilized over the current biennium and is not something typically afforded to administrative accounts. As a result, given the anticipated receipt of federal pass-through funding over the 25-27 biennium, in addition to the completion of initial waiver development and activities, fiscal staff recommends not continuing this language in other closing item 1. The motion in the middle of page 93 reads, fiscal staff recommends not approving other closing item 1 and requests authority to make technical adjustments as necessary.
Do we have any further questions? Seeing none, entertain a motion.
A motion to approve is stated by staff.
Second.
I have a motion from Assemblymember Mosca, second from Senator Don Daraloop. Do we have any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. This is sort of over the hill, so we're on the downhill side. This begins, budget account 3177 is the Improve Healthcare Quality and Access, also known as Private Hospital Provider Tax Fund Program. There are 3 major closing issues, the first of which begins on page 95, is a general overview of the private hospital provider tax funding. The governor recommends total private hospital provider tax revenue of approximately $400 million in each year of the 23-27 biennium to support supplemental and directed payments to eligible facilities. The table, the very large table on page 96, attempts to include a summary of all of the various components, including total revenue, interest revenue, balance forward, the transfers to Medicaid to cover supplemental directed payments, as well as the components that would cover continued services as approved by the April IFC in 2024, components in the current budgets as approved just now for new services, and also note the need for an $11.5 million technical adjustment. Similar transfers to checkup for continued and new services, and transfers to Medicaid administration for continued and new administrative support. There's also two reserves in this budget account. One is the administrative reserve that includes remaining components of that 15% administrative component to cover both associated 25 hearing. The subcommittee requested a status update on the required annual federal authorization of the program. At the time of the hearing, the agency indicated it had received approval for an early release of a quarterly payment totaling approximately $200 million. And in subsequent follow-up provided in April, the agency confirmed federal approval for calendar year 25 was approved and that there are no major changes to hospital payment amounts. However, the approval was provided contingent on the agency continuing to work with federal partners. As noted in the previous table, an $11.5 million adjustment to correct revenue transferred from Medicaid and instead put it in the administrative reserve was requested by the agency and appears reasonable, along with a small adjustment to remove duplicated funding to checkup. The decision on page 97 reads, does the subcommittee wish to recommend approval of a technical adjustment to move expenditures totaling $11.5 million in each year of the 25-27 biennium from the transfer to Medicaid category to the administrative reserve category as requested by the agency, in addition to a technical adjustment to remove duplicated transfer funding to the checkup budget totaling $791,073 in each year of the 25-27 biennium.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, second from Senator John Darrow Loop. Do we have any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. John Cusero, LCB Fiscal for the record. Moving on to major closing issue 2 is continued funding of behavioral health services along with growth of private hospital provider tax. As was noted during the Medicaid discussion, there are two major components of this, which includes supplemental and directed payment growth of approximately $21.4 million in each year based on updated projections. And then also moving to page 98 is continuation of behavioral health services approved at that April 2024 IFC meeting. The 7 associated services as approved are noted at the table at the top of page 98. Hearing discussion updates towards the bottom of page 98. The subcommittee requested a status update on services approved. The agency indicates all the approvals could be retroactive, effective to January 2025. However, all of the state plan amendments have been submitted to the Centers for Medicare and Medicaid Services, and all are awaiting federal approval. Details related to select services associated with the Department of Justice settlement agreement are still being considered in concert with federal partners. In response to questions regarding the procurement of an actuary to review utilization and services supported, the agency indicated a contract with an actuary was being considered by the board and would be used to support, and in follow-up correspondence indicated that this actuary would be used to support the agency's calculations of the baseline and performance period data for rate increases and enhancements for the private hospital provider tax program. Based on the nascent nature of this program, the subcommittee may wish to recommend the issuance of a letter of intent directing the agency to provide a report to the IFC no later than August 1st, 2026. It would contain the results of completed actuarial analyses which detail baseline calculations and actual utilizations of each service funded with private hospital provider tax revenue to ensure private hospital provider tax funds are appropriately utilized and maintained separate and distinct from general fund appropriations supporting similar services. The decision for the subcommittee at the top of page 99 is as follows. Does the subcommittee wish to recommend approval of $34.1 million in additional provider tax revenue and reserve reductions totaling $72.0 million over the 25-27 biennium to support the continuation of behavioral health service expansions and rate increases in addition to projected private hospital provider tax supplemental and directed payment growth? And does the subcommittee wish to recommend the issuance of a letter of intent directing the agency to provide a report to the Interim Finance Committee no later than August 1, 2026, containing the results of completed actuarial analyses, which detail baseline calculations and actual utilization of each service funded with private hospital provider tax service revenue to ensure private hospital provider tax funds are appropriately utilized?
Do we have any other questions? Seeing none, I'd entertain a motion.
Thank you, Chair. Motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator John Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you. Moving on to major closing issue number 3, which is largely a summary of the private hospital provider tax funding for expanded services and rate increases. The table is at the top of page 100 and notes what components would fund the Children's Managed Care, Specialty Managed Care Organization, service expansions, and rate increases. If my memory serves, E272 and E273 on the rate increase side were not recommended for approval, and fiscal staff would recommend decisions associated with this major closing issue be made consistent with the decisions made in the previous budget accounts. There was no associated follow-up or questions from the subcommittee, and all recommended items are included in the Medicaid budget account. And again, fiscal staff recommends all items be closed consistent with approval of the associated major closing issues. Decision for the subcommittee on page 100 states, does the subcommittee wish to recommend approval of private hospital provider tax revenue totaling $17 million in fiscal year 26 and $19.8 million in fiscal year 27 to be transferred to the Medicaid Administration and checkup budget accounts to fund the non-federal share of expanded services, rate increases, and administrative expenditures consistent with the recommendations made in major closing issues within the Medicaid budget account.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries.
Thank you, Madam Chair. There are no other closing items, and fiscal staff recommends technical adjustment authority as needed.
Any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
A motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving on to budget account 3160 on page 101 of your closing packet is the increased quality of nursing care. This is the second provider tax program that provides supplemental payments to nursing care facilities. There's a single major closing issue to continue the program, and the governor recommends total nursing facility provider tax revenue of $51.9 million and $54.8 million in fiscal years 26 and 27, respectively, to serve as the state share of funding for supplemental payment programs. Skipping very quickly to the update on page 102. There were no questions or concerns raised, and on April 16th, the agency confirmed no changes were projected. Given the concerns expressed with the calendar year 25 approval for the private hospital provider tax program, fiscal staff inquired about the similar need for an approval on this program. According to the agency, due to limited room between the managed care organization rate and the average commercial rate, in addition to data availability concerns to support the ACR, the average commercial rate, approval of the calendar year 25 preprint, allowing managed care state-directed payments for nursing facilities was not likely, according to the agency. And this was and this calendar year 25 preprint for the nursing facility program was not submitted. However, the agency indicated in consultation with its consultant it would be able to maintain average rates of approximately $275 per day through a combination of fee-for-service claims, supplemental fee-for-service payments, and managed care claim payments. The motion at the bottom of page 102 asks, at the middle of page 102, does the subcommittee wish to recommend approval of $106.7 million in provider tax revenue to support $395.3 million in supplemental payments to nursing facilities over the 25-27 biennium as recommended by the governor?
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
Have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries.
Thank you, Madam Chair. There's a single other closing item here at the bottom of page 102 relating to an adjustment to the reserve balance. Fiscal staff recommends other closing item 1 be closed as recommended by the governor and requests authority to make technical adjustments as necessary.
Any questions? Seeing none, I'd entertain a motion.
Motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. John Kucera, LCB Fiscal for the record. Moving on to the Intergovernmental Transfer Program, budget account 3157 on page 105 of your closing packet. The IDT, or the Intergovernmental Transfer Program budget account, collects funds from other governmental entities to provide the state share of certain Medicaid expenditures, reducing the need for general fund appropriations. There is a single major closing issue on page 106 and continuing on to page 107 relating to a proposed academic partnership, which includes $339,773 in revenue transferred from the UNR School of Medicine to support the non-federal share of an academic partnership. The positions as recommended by the governor are outlined at the table of top of page 107. And the agency indicates the UNR School of Medicine would recruit and employ physicians to serve as Medicaid clinical advisors, which would support state officials in improving health outcomes for Medicaid participants. The update provided during and after the March 24th, 2025 hearing provided additional details, and the agency described 3 positions, including the additional component of perhaps additional positions and perhaps additional partnerships with other teaching entities. Additionally, the agency indicated an intent to further increase the scope of the program, and while additional funding was not recommended in a budget amendment, funding to expand the scope of the program may be requested through a work program revision. The motion at the top of page 108 reads, does the subcommittee wish to recommend approval of $339,773 in revenue transferred from the UNR School of Medicine in each year of the 25-27 biennium to fund the non-federal share of an academic partnership as recommended by the governor?
Do we have any questions? Seeing none, I'd entertain a motion.
A motion to approve is stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator John Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. There are many other closing items. These are all discussed as major issues in other budget accounts, so I won't go into intimate detail unless there are questions. One note, fiscal staff made an adjustment to the reserves reflecting the impact of a work program approved by the Interim Finance Committee, as well as adjustments to FMAP claiming as reflected in A 25-048-32-43. Fiscal staff recommends other closing items 1 through 4, 6, and 7 be closed as recommended by the governor. Other closing item 5 be closed with the noted technical adjustments to eliminate the balance forward and reserve amount, and request authority to make other technical adjustments as necessary.
Any further questions? Seeing none, I'd entertain a motion.
I motion to approve is stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator John Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Thank you, Madam Chair. Moving to the second to last budget account is the Indigent Hospital Care Budget Account 3244. The Indigent Hospital Care Budget was established to reimburse hospitals for the care provided to indigent persons. There's a single major closing issue related to the transfer of funding to the Division of Healthcare Financing and Policy. Previously, these decision units have either been in caseload updates or in the base budget, and the recommendation, including base and E250, represents projected caseload growth to transfer $107.4 million to the Division of Healthcare Financing and Policy to fund 2 components: the Medicaid Indigent Accident Fund UPL, or Upper Payment Limit Supplemental Payment Program, of $52.7 million, and the support for a portion of county's responsibility to pay the non-federal share of Medicaid expenditures for certain indigent individuals totaling $52.3 million. The table at the middle of page 112 includes the various components as stated, the share of the IAF supplemental payment, and then an offset to county's responsibilities to support the indigent population and associated administrative expenditures. The table on page 113 includes the offset by county, which is a proportionate share of the county's participation in this program. There was no updated information provided and no questions posed by the subcommittee. The decision for the subcommittee at the bottom of page 113 asks if the subcommittee wishes to recommend approval to transfer $107.4 million to the Division of Healthcare Financing and Policy, including support for the state share of the Medicaid Indigent Accident Fund Upper Payment Limit Supplemental Payment Program of $52.7 million, and support for a portion of county's responsibility to pay the non-federal share of Medicaid expenditures for certain individuals as recommended by the governor, and fiscal staff also requests authority to make technical adjustments as needed.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve is stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator John Darrow Loop. Any further discussion on the pending motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. The last budget for the subcommittee's consideration this morning is the UPL Upper Payment Limit Holding Account, Budget Account 3260 on page 115 of your closing packet. The UPL holding account was authorized by the 23-25 biennium pursuant to Section 57 of the 2023 Appropriations Act to allow various divisions within the Department of Health and Human Services to transfer savings associated with healthcare contract expenditures that are budgeted but not incurred. Similar to the prior budget account, this major closing issue reflects the continuation of this budget account, as well as caseload updates based on updated projections. In total, funded with transfers from other budget accounts from the Department of Health and Human Services as recommended by the governor would be $11.4 million in fiscal year 26 and $11.5 million in fiscal year 27. The table on page 116 indicates the contracts that would be offset, which represent the transferred funding. There is an update on page 116. Following the March 24th budget hearing, there weren't any concerns posed by the subcommittee. However, technical adjustments were entered and recommended in consultation with the agency to reflect updated FMAP rates for the biennium, as discussed in the Medicaid budget account. After adjustments, transfers are projected to total $9.1 million in fiscal year 26 and $9.3 million in fiscal 27. General fund reversions are projected to be $1.2 million each year, and Fund for Healthy Nevada or Tobacco Settlement Fund reversions are projected to be $1.1 million in fiscal year 26 and $1.0 million in 27. And the agency concurs with these recommended adjustments. The decision at the bottom of page 116 is as follows. Does the subcommittee wish to recommend approval of continuing the UPL holding account in the 25-27 biennium to support Medicaid supplemental payments, including the noted technical adjustments as recommended by the governor?
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously.
Thank you, Madam Chair. Very last item. This relates to the continuation of the UPL budget account. This is created through the 2023 and historical appropriations acts. This UPL account was originally established in the 13 to 15 biennium and has been reauthorized in subsequent biennia. This budget account would need to be authorized for the 25-27 biennium through language in the 25 Appropriations Act, and the governor recommends language to continue this budget account in the upcoming biennium. The motion at the top of page 117 asks fiscal staff recommends approval of the other closing item as recommended by the governor and requests authority to make technical adjustments as necessary.
Do we have any questions? Seeing none, I'd entertain a motion.
And I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. And any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously. Oh my gosh, did we just get through all of this? We can give a big round of applause here to Mr. Kucera for getting us through that. That does bring us to the end of all of the budget things. But before we get to public comment, if I could just take a moment, and I know that Chair Mosca would also like to take a moment. This brings us almost to the end of this session's last hearing of the Human Services Joint Subcommittee. And I just want to take a moment to say that it is truly an honor to chair this subcommittee for the second time in a row, and serving with Chair Mosca, who I consider a friend, like a really, really smart friend who happened to go to Harvard, has been incredibly special as well for me and personally. So I really want to thank the agencies, and I think I speak for the chair as well, and especially the incredible director, Richard Whitley. I know he's here, and he's probably so mad that I'm putting him on the spot right now. But without him and his entire team for working with our members and always being available for those late night questions and texts and calls, we do appreciate that. We appreciate you working with our fiscal staff in order to accomplish all this. We have all the supportive staff, including our secretaries, committee managers that put together some of the biggest budgets and have to organize us and herd cats to get us all in this room by 8 o'clock or 8:15 or 8:20 or whenever we decide to start. But we wouldn't be here without our amazing fiscal and committee staff. And so just to point out some of the people that you have heard read and go through all these and fix all the technical adjustments, make this understandable. They are like our own AI and ChatGPT, where I asked them if we had licensing for like walkout music. I'm sure they would each have their own song, but since we can't do that because we would be pulled from YouTube, I won't play any music. But if we could start by thanking John Kucera, the Division of Healthcare Financing Policy, Justin Luna, the Program Analyst, Division of Public and Behavioral Health, Morgan Barlow, the Director's Office, Division of Public and Behavioral Health, Kimbra Ellsworth of Aging and Disability Services Division, Colby Nichols, the Division of Welfare and Supportive Services, Daniel Miller, the Division of Child and Family Services, Madison Ryan, the Department of Employment, Training, and Rehabilitation. Of course, Kathy Crockett, our Chief Principal Deputy Fiscal Analyst for the Senate, Brody Lesnar for the Chief Principal Deputy Fiscal Analyst for the Assembly, the amazing Sarah Kaufman, the Assembly Fiscal Analyst, and of course, last but not least, Wayne Thorley, who I know likes to stay away from all these healthcare issues, our Senate Fiscal Analyst, and I hopefully did not miss a bunch of other people, but I just want to say that it has been a privilege, and your work and all the effort that you put into this is amazing. And with that, I will turn it over to Chair Mosca to make any statements as well.
Thank you. Thank you, Chair. I second your statements. I'll be very brief. I just want to thank you for your help, Vice Chair Monroe Moreno. This is my first time on Ways and Means, so I've learned a lot. I appreciate everyone. I want to thank our members, and of course, I actually want to thank Ms. Thomas, who does all of the scheduling to make sure this all works. So thank you, everybody.
Thank you. And with that, we will move into our last agenda item, which is public comment. So if you are here to testify in public comment, I would ask you to come up to the table. Remind you to please push that little button, and once the mic is on, please state your name for the record. For the ease of our committee staff, if you could also spell your name for the record, that would be super helpful as well. And go ahead and begin when you're ready.
Hello, my name is Abby Bernhardt, Bernhardt. I am with NAMI, Nevada. At 3 years old, I was diagnosed with bipolar disorder, a journey that has shaped my life in profound ways. By the time I turned 10, I found myself on 10 medications due to step therapy. Whenever one medication didn't work, my psychiatrist added another. This was a confusing and difficult time, especially since I was expected to continue my education while grappling with such overwhelming challenges. My educators caused me to feel, I faced harsh judgment from my educators who told me I was hopeless and helpless and never going to amount to anything. The weight of those words stayed with me each night, compounding my struggles. The year was tough, resulting in 10 hospitalizations and a very dark moment where I attempted suicide. I was just a child trying to cope with a crisis. During the 2023 legislative session, I fought to protect bills like SB 167 and SB 177. These initiatives aim to streamline the process of accessing essential medication, allowing doctors to prescribe based on individual needs without unnecessary hurdles, saving money and lives. As a passionate Nevadian and advocate for mental health, I must empathize that our state faces significant challenges. We're among the lowest ranked in mental health, and our suicide rate is among the highest rates in the country. It's heartbreaking to see how many community members struggle. It is vital for many people in our state who rely on Medicaid. Everyone deserves dignity, respect, and access to the care they need. Thank you for working together to ensure that Medicaid remains strong and available to those who depend on it.
Thank you. Do we have anyone else in to testify in public comment? Seeing no one here or in Las Vegas, we can go to the phone lines for public comment.
If you would like to provide public comment, please press star 9 to take your place in the queue. Chair, the public lines are open and working. We have no callers choosing to provide public comment at this time.
Thank you. And with that, we will close public comment. If you did have problems with public comment, we will have other public comment opportunities in finance or ways. So I'd encourage you to do that. And with that, before I close the meeting, I did want to wish Assembly Member Brown May a very, very happy birthday today. So if you see her in the hallway, make sure. I'm just embarrassing everyone today. Anyway, and with that, I will adjourn this meeting.